Good morning, everyone. I'd like to call this meeting to order. My name is Jim Hart, and I'm the chair of the Toronto Police Services Board. Welcome to this virtual meeting of the board. Although this meeting is taking place virtually, we acknowledge that the land we're on as we hold this meeting is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. It is now home to many diverse First Nations, Inuit, and Métis people. The board also acknowledges that Toronto is covered by Treaty 13, signed by the Mississaugas of the Credit, and the Williams Treaties, signed with multiple Mississaugas and Chippewa bands. Are there any declarations of interest under the Municipal Conflict of Interest Act? Seeing none and hearing none, I'll now turn this meeting over to our board's Executive Director, Ryan Teschner, who will go over the meeting logistics. Mr. Teschner?
Thank you, Chair Hart, and thank you to everyone who has joined this virtual meeting. Please note that, as always, this meeting is being live streamed on the Toronto Police Service YouTube account and will be available there at the conclusion of the meeting, as well as all of the archives of our previous meetings. On the line, we have Chair Jim Hart, Vice Chair Councillor Francis Nunziata, Councillor Michael Ford, Member Ainsworth Morgan, Member Lisa Kostakis, as well as our newest member of the board, Ann Morgan, and joining us shortly will be Mayor John Tory. On the line, we also have members of our board office staff, Chief Raymer, members of his command team, other members of the service, and of course, a welcome to the members of the public. We have individuals who have registered to make deputations on our agenda items, and as per our regular meeting process, deputations will be heard prior to the item being discussed and voted on by board members. When it comes time to do a deputation, those who have registered will be brought into the call by our colleague, Du Buchanan-Gisser, and as always, deputants will speak, followed by an opportunity for board members to ask them questions. Mr. Chair, I'll turn it back over to you.
Thank you, Mr. Teschner. I'd like to begin by welcoming Ms. Ann Morgan to our board as our newest member. Ms. Morgan will bring to the board a unique and important perspective. Ms. Morgan's vast past experience in practicing criminal law in Toronto as Crown Counsel and her work in the criminal justice system over a number of decades has equipped her with a deep appreciation of the complex issues and challenges the service and our communities face. There's no doubt that her distinct lens and expertise will be a critical asset to the board in its policymaking and governance role as we move forward. On behalf of the board, I wish to extend a sincere welcome to you, Ms. Morgan. We look forward to working with you with all of the important issues that are before us, incorporating your unique and vital perspective. Mr. Teschner, I'd like to turn over to you now to swear in Ms. Morgan. Mr. Teschner?
Ms. Morgan, good morning.
Good morning.
Thank you, Chair Hart. It is truly a pleasure to swear in our newest member, Ms. Ann Morgan, who was recently appointed to the Toronto Police Services Board by the Province of Ontario for a 3-year term. Ms. Morgan is a retired Crown Counsel with considerable expertise, who's well regarded with her experience in criminal law. Called to the bar in 1984, Ms. Morgan joined the Toronto Downtown Crown Attorney's Office at the Ontario Ministry of the Attorney General in 1986. Her areas of specialty included wiretap applications, search warrants, and homicide prosecutions. Through her noted skill and dedication, Ms. Morgan steadily rose through successive positions within the criminal law system and was appointed as Deputy Director of Crown Operations in Toronto in April of 2011. She retired from the Ministry of the Attorney General in March 2017. Throughout her career, Ms. Morgan has been involved in continuous learning, teaching courses at the University of Toronto Law School and through the Ontario Crown Attorneys Association. She continues to participate in educational and advocacy initiatives. I have no doubt that Ms. Morgan will be a valuable addition to the board at this time as we continue to modernize in areas of governance, greater community capacity building, and police reform to better meet the needs and expectations of the public. And now I will administer, Ms. Morgan, your oath. Are you swearing on a Bible?
Yes.
And if you'll repeat after me. I solemnly swear that I will be loyal to Her Majesty the Queen and to Canada.
I solemnly swear that I will be loyal to Her Majesty the Queen and to Canada,
and that I will uphold the Constitution of Canada,
and that I will uphold the Constitution of Canada,
and that I will, to the best of my ability,
and I will, to the best of my ability,
discharge my duties as a member of the Toronto Police Services Board,
discharge my duties as a member of the Toronto Police Services Board,
faithfully, impartially, and according to the Police Services Act,
faithfully, impartially, and according to the Police Services Act,
any other act, and any regulation, rule, or bylaw.
any other act, any other regulation, rule, or bylaw.
So help me God.
So help me God.
And your oath of secrecy. I solemnly swear that I will not disclose any information
I solemnly swear that I will not disclose any information
obtained by me in the course of my duties
obtained by me in the course of my duties
as a member of the Toronto Police Services Board,
as a member of the Toronto Police Services Board,
except as I may be authorized or required by law.
except as I may be authorized or required by law.
So help me God.
So help me God.
Congratulations and welcome.
Thank you. Thanks very much. It's really an honor, and I really look forward to meeting all of you in person at some point, someday. But thanks for the warm welcome, and thank you again to Ryan and all the others of his staff who've made me feel so welcome and have assisted me with preparation with so many materials. I have to tell you, after reading some of them, I thought, what have I got myself into? Maybe it's time to bow out, but I'm really looking forward to the challenge and learning from all of you. So thank you so much for welcoming me.
Thank you, Ms. Morgan, and back over to you, Mr. Chair.
Thank you, Mr. Tesher, and welcome again, Ms. Morgan. I'd like
Thank you.
to now make a few comments with regard to the missing persons report that we received last week. The board received the report by the Honorable Gloria J. Epstein, head of the Independent Civilian Review into Missing Persons Investigations. This extremely comprehensive report, a culmination of almost 3 years of diligent and dedicated research, detailed analysis, as well as consultation with Toronto's LGBTQ2S+ communities and other communities, is forthright and powerful. We want to thank Judge Epstein and her whole team for their hard work and diligence and their sincere commitment to bringing the community together in looking for answers and seeking a transformative approach as we forge a path forward. We also want to thank community members, organization representatives, and those who were impacted by the loss of loved ones for coming forward and sharing their experiences and insights with the review during its work. As Chief Raymer, on behalf of the service, and I, on behalf of the board, stated the day the review released its report, the service and the board accept all of the review's findings and commit to implementing all of the recommendations. Of course, this report deserves and requires a thoughtful and deep review. We must assess each of the recommendations, not in isolation, but as part of a larger and broader context of police reform that is now underway. It's important now to turn to next steps. What will be done immediately in concrete terms? As outlined in the recommendations on or before June 30th, 2021, the service will assemble a diverse implementation team comprised of community representatives and service members with a particular focus on the LGBTQ2S+ and marginalized and vulnerable communities addressed in this report, as well as individuals who have already acquired knowledge of the issues this report identifies, and service members who are part of the service's Missing Persons Unit Procedures Working Group. On behalf of the board, representatives of the Office of the Toronto Police Service Board will be involved and engaged as appropriate. The team will be tasked with developing an implementation plan for all of the services, or rather for all of the review's 151 recommendations. As noted in the recommendations, the team will be co-led by a community representative, and Superintendent Pauline Gray has been designated as the service's senior representative. Lastly, the report outlines various timelines for the team to report on its progress. in implementing the recommendations. The reporting requirements speak to the importance Judge Epstein clearly attaches to transparency and accountability in terms of these recommendations, and the vital importance of public awareness, understanding, and engagement throughout the implementation process. So some of these milestones are: on or before September the 30th, 2021, the implementation team should complete its implementation plan and post it on the service's website or other suitable venue. The team should also issue progress reports at least once a quarter. On or before April the 30th, 2022, the board and the service should publicly release a detailed report on the extent to which each recommendation has been implemented. We embrace the work that's ahead of us, and we look forward to providing the public with a transparent and fulsome update along the way, as well as opportunities to provide their perspectives to the board on those updates at future meetings and in other forums. Mayor Tory, I understand you would like to say a few words as well.
Thank you very much, Chair. I really just want to, you couldn't thank yourself, and so I will do that for starters, but I just wanted to say, first of all, starting with Judge Epstein and her counsel, Mr. Sandler, you know, I think what we've seen here, I'm not sure there was anybody else who could have written a report and who could have consulted and engaged the community as credibly and effectively as Judge Epstein. You know, if you look at her entire history, including with some of the communities that were very much involved in this, it gave her a unique perspective. And it's why I think that she was the right person to be asked to do this. And she carried this out in a way that was sensitive. It was consultative. It reached beyond Toronto and beyond the particular facts that she was looking into here to give us advice from other parts of the country and other parts of the world. And I think as a result, we have a landmark report here. And I think the challenge is going to be, as always with these landmark reports, you know, what do you do with them? Besides having them come out. So I want to just say thank you to her and to her counsel and her team, because I think they've produced something here that is a landmark report. And what's interesting about it is, I think if you think about it, it's a landmark report that goes way beyond missing persons and how given communities have been treated and so on, and extends to a rethink that we're in the process of doing, I think, if we really look at it, as to how we generally engage people, treat people, and follow true to our values in the city that would say, and the country, but in the city that would say that we treat everybody the same and that we treat everybody at a high level of respect and engagement and have a productive, positive relationship with them. The second people I want to thank, as you did, is just the community, because again, you know, it's one thing to consult, and we quite often see instances where we have public meetings on different subjects and nobody comes. And that's frustrating for us because we want to consult the public in many cases, but it's sometimes a real challenge to engage people. But again, the community came forward in no uncertain terms and made their views known thoughtfully and directly. And it was immensely helpful to the product that was produced, because these things, when they're by the community, from the community, and of the community, with the effort of Judge Epstein to do that, and then the community responding, makes for a much better report. And finally, I do want to say thank you to you and the Chief, because, you know, I've been around in governments long enough to know, only in elected office for 6 years, but around governments long enough to know that there are two ways you could deal with a report. One is just to say, well, we're going to study that report, and then maybe nothing much is ever heard again. But the other is, starting on the first day, to ensure that there is the sort of requisite amount, in this case, of sensitivity, of responsiveness, and frankly, a degree of contrition, you know, with respect to some things that clearly were not done to the standard that anybody would expect, including the Toronto Police Service. And that was said on the day it came out, which I think was very important, just in this, from the standpoint of getting a good start on the implementation, but also from the standpoint of the sensitivity of the communities that care about this, which I would say the whole community cares a lot about this. You only have to have somebody go missing in your family, it doesn't matter what family you are, to understand what a sensitive matter this is. And finally, just to conclude, the implementation, as you've said, Mr. Chair, and by the way, you were very much a part of that with the Chief, and I thought you both handled yourselves in a way that I was certainly very proud of, in terms of response on that day right away. And finally, the implementation is key, and I think the key, as you mentioned, is, I think you used the expression co-leadership with the community. And I think that's going to be important. We've learned something from, and we learn every time we engage the community and listen and consult and involve them, that you get a better product. And that'll be true of the implementation as well. So hopefully we'll just be starting now to engage with the community in the implementation of this. And I think it'll pay huge dividends for us in many different ways. And so I stand here as a board member, I'm sure all of our colleagues ready to do that work and ready to support the service in doing the work that has to get done. So thank you to all of those people, but to you and the chief as well, because you, I think, responded in a way that was just almost as important as the content of the report itself. Thank you, Mr. Chair.
Thank you, Mayor Tory. Chief Raymer, would you like to say a few words?
Thank you, Chair Hart. The missing person report was difficult to read. Justice Epstein has given our service much to reflect on about who we are and how we carry out the jobs we are entrusted to do. Much of what Justice Epstein uncovered reflects organizational shortcomings with respect to processes, supervision, and accountability. And most importantly, shortcomings in how the service investigated missing persons, particularly those in our marginalized communities, and how we engage those communities. As an organization, we acknowledge the mistakes made, the process failures, and the gaps. The service accepts the responsibility of these systemic issues, including not meeting provincial standards with respect to major case management, including the Power Case software. We know that many in Toronto's LGBTQ2S+ communities felt and still feel a sense of mistrust between us. To the family, friends, and community members, we have apologized for the impact our actions and inactions had and continue to have on their lives. This report will guide the Toronto Police Service as we pursue the fundamental change that is needed to begin the crucial process of reconciliation with these communities we have let down. Not only have we committed to all of the 151 recommendations, but we have already taken the initial steps towards implementation. Acting Staff Superintendent Pauline Gray, who has 34 years of experience across the organization and in our communities, will co-lead an implementation team that will modernize our work with communities and ensure we consider their perspectives, insight, and knowledge so the Toronto Police Service is serving and protecting every single member of the public. We have already begun conversations with the community to construct the broad-based internal and external member group that will form the implementation team. The formulation of the team will be as important, in my view, as the completion of the 151 recommendations. We recognize that how we implement these recommendations will affect how successful we are in making the necessary repairs to community trust in the police, and we will follow Justice Epstein's guidance and schedule. We are committed to real partnerships with communities from the outset to work with us on the effective implementation of these recommendations. And through this process, we will work to understand and remove the barriers that exist between us. I am committing to this process, that this process will be public and transparent, and we will include updates on our implementation progress. Thank you, Chair.
Thank you very much, Chief Raymer. Board members, we will now go through the agenda. Item number 1 on the agenda is the confirmation of the minutes from the virtual public meeting held on March the 23rd, 2021. We have deputations on that item, so item number 1 is held down. Item number 2 is mobile crisis intervention, and there are 2 separate items there. The mobile crisis intervention team expansion plan presentation and the report from the chief. That item is held down for presentation and deputations. Item number 3 is special constable appointments, April 2021. Can I have a motion to approve item number 3? Vice Chair Nunziata, could I have a seconder? Lisa, all in favor? Any opposed? Item number 3 is carried. Item number 4 is vehicle towing and storage service contract awards 2021 to 2026. I will be holding that item down. Item number 5 is the 2022 Budget Process Board Committee. Would any board member like to move adoption of item number 5? Mayor Tory, anyone wish to second that? Ms. Kostakis, all in favor? Any opposed? Item number 5 carries. Item number 6 is the Toronto Police Service 2020 Annual Hate Crime Statistical Report. Can I have a motion to approve item number 6?
I hold that, please, for some questions, Mr. Chair.
Mayor Tory has it held down. Item number 7 is a response to the motion with regard to the Toronto Police Service Intercultural Development Program and the application of the Intercultural Development Inventory Asset Assessment Tool. Can I have a motion to approve item number 7?
Could that be held down, Chair Hart?
Yes, Mr. Morgan is holding item number 7 down. Item number 8 are a series of budget variance reports. We have deputations on item number 8, so item number 8 is held down. Item number 9 are reports regarding consulting expenditures. We have deputations on item 9, so item 9 is held down. Item number 10 is the Chief's Administrative Investigation Reports. We have a deputation on item 10, so item 10 is held down. And item number 11 is the response to the jury recommendations for the coroner's inquest into the death of Mr. Rui Felipe Nabico. Item number 11 has deputations, and that is held down. So we'll now move back to the top of the agenda, which is item number 1, the confirmation of the minutes from the virtual public meeting held on March the 23rd, 2021. And Doobie, can you put on the first deputant, please, when you're ready?
Yes, sir. That's Chris. Chris, can you hear me? You should get a prompt from the system now to unmute.
Hi, good morning.
Morning. We can hear you. Go ahead when you're ready.
Thank you, Doobie, and good morning, board. I'd like to start by pointing out that you had your 5 to 10 minutes of speech there about Justice Epstein's report, but in fact, the board has yet to receive that report. This item should be an item on the agenda, and obviously the public should have a chance to address this matter. So I guess you're going to have to add it to next month's report to actually officially receive this report before the board so that you can consider it. Moving on, I wanted to thank the service for last month, Chief Raymer, for you having put the details of the procedures here for item 1104, procedure for protests and demonstrations, and it is about what we'd expect. Basically details of the responsibilities of police officers, supervisory officers, officer in charge and staff superintendent, and how they're the procedures they're supposed to go through. Of course, what I had also requested separately from the board, or from the chief actually, was details on how the what instructions officers have been given in terms of how to respond to protests related to COVID, and I still haven't seen anything on that. And of course, this goes back to, in fact, it's Justice Morden's recommendation number 27, going back to the G20 report, his report from 2012, I believe it was, where he said, recommendation 27, board to create a comprehensive policy on crowd control and mass demonstrations. And that is what we need. That's the difference between policy and procedure. Procedure, of course, tells officers what to do and how to do it, how to fill out a traffic ticket, etc. Policy explains why you're doing it and what the expectations are, and the overreaching concepts here, such as what do we expect our officers to respond in terms of dealing with COVID protesters. That's what the board's responsibility is. That should be an item as well on the board's discussion here. That should have public input so that we're getting feedback from the public on what we expect the response of police to be. Chief, I got to say thank you again. I saw some video there from Rebel News with last week's protest and officers there, but not getting physical, and I don't know the details if there were any tickets or arrests given there, but certainly glad to see an improvement over what we saw in the initial stages of this in terms of police response to protesting and to people exercising their charter rights to be out there protesting. This is certainly now over a year into this. It's understandable that a lot of the members of the public have opinions on the whole Emergency Measures Acts and emergency powers being given to people and enforcement of laws without full discussion of democratic processes. And so this is when protesting becomes very important. And that's why this is an important matter that we need to deal with. And we need to have, and I'm glad to see again that police are improving their response to that. But this is really where it comes down to the board to be giving the proper direction to police and to be having the proper public consultations. And in fact, having some public consultation would give some of these people that are out there on the street protesting the opportunity to speak to the people in power in an environment where they can actually be heard rather than being out there standing there surrounded by police. That's it. Thank you.
Mr. Langenfeld, thanks very much for your deputation. Any questions of Mr. Langenfeld? Mayor Tory?
I have, Mark, maybe a question of you, Chair, based on Mr. Langenfeld's deputation, because I think he raised a good point, and I may know the answer to it. I don't think I'd heard it discussed. What was the plan with respect to, I mean, we've talked this morning in our remarks, and we saw it in Justice Epstein's report about recommendations she made that we're by and large accepting about how it's going to be implemented. But what was the plan? Knowing that she had a lot of public consultation leading up to her report, but of course the public have just seen her report in the last week or so. And the logical place where it would be discussed, to Mr. Langenfeld's point, is at, I guess, at our board. What is the plan with regard to having that report discussed? I mean, it's such a big piece of work that I sort of tend to think to myself that, you know, if you did it at a regular meeting, you might take up the entire meeting discussing something as important as that. So have you given some thought to a process that might allow the public to come in now that the report is in hand and comment on it? Because I think it's a very fair question Langenfeld asks in that way.
Yes, thank you for that, Mayor Tory. I agree, it is a very fair question, and we have given a lot of thought to that with regard to the report. And as our intention, the service is still digesting the report. As we know, it's 1,100 pages long with 151 recommendations. That takes a little bit of work, to say the least. And the plan is for the service to come back with an implementation plan before the entire board, at which time the public will be able to come in and take a look at not only the report itself, but even more importantly, in some respects, the implementation plan and how we're going to get there, and be able to comment on that and give us advice in that regard. So I think that's an extremely critical part of the process that we hear from the public on how we're going to do things.
Okay, and may I just ask you to give consideration with on to the possibility of a special meeting or something in that regard, just because it is an 1,100-page report, it is 150 recommendations, et cetera, et cetera. And if we tried to do it in a regular meeting, I'm not sure how that would work, but I'll leave that with you, Chair. May I make one more comment also on Mr. Langenfeld's deputation? And it's a comment, just again to say to the chief that I was incredibly impressed both yesterday with the document that was put out that probably had more explanation given to the public about how the police would enforce the law with respect to the whole COVID thing, if I can call it that, and also with his forthrightness with respect to the matters that came up at the end of last week in terms of police powers. I just thought that it was maybe the hallmark of a slightly different approach to these kinds of things than we had seen in prior years. And that's not being critical of anybody. It's just saying going way back. I'm not sure we had that degree of openness and explanation to the public of how things would be. And I think it's a very big step forward. So I just, since Mr. Langenfeld raised that too, thank you.
Thank you, Mayor Tory. Any other questions of the deputant? Seeing none, thank you, Mr. Langenfeld. Doobie, can you put on the second deputant, please?
Yes, Chair. Mr. Albert Wenzel, you should get a prompt from the system to unmute now.
Hello, I'm here. Can anyone hear me?
Yes, we can hear you. Go ahead when you're ready.
Okay, thanks. Yeah, there's a glaring omission in the review's final report. So I would urge the board to send the report back to the review and tell them to include all of the omissions. And I can tell you exactly what the omissions are. The cross-examination of Ryerson University, of reporters, and of 51 Division. All of that is missing from Judge Epstein's report. They started off well. They took my statement. They have a copy of the mass email warning, Bataclan Theater. The witnesses were honest and gave the same account as mine. And they cross-examined 51 Division, who was who had the forewarning of Incel Danforth MacArthur. None of that appears in the final report. It's just censored out and omitted in the end. Further, I also correctly predicted coronavirus, which contained Ukraine Jet 752 and Kobe Bryant and other events. The review has an audio recording of this. Where's the transparency? Where's the accountability? Office of the Chief told me Kobe Bryant is not their catchment area. Why do they keep doing that? For the past 40 years, I've correctly predicted events. Police do nothing. Information is correct. Nobody does nothing. Further, that coronavirus warning was sent to Susan Gao, spokesperson for the Pentagon. They acknowledge receipt. Gao is also the spokesperson on UFOs. They're coming out now with grainy videos. That's a hot potato in the review. Where is that in missing and missed? The Ryerson witnesses were honest. They reported the Ryerson abduction to the review for lack of having anywhere else to go. All of that is censored out by the review. And there's a resolution to this. Suppressing this information holds humanity back. The level 1 civilization has flying cars and they communicate by telepathy. They're way more advanced and civilized than us. Over here, censoring this kind of information holds humanity back. 0 point energy is working now. That has been censored. And I will suggest a resolution. The board has weight to throw around. Convene the mediation room on Bay Street, bring in all the witnesses, and get them to make an honest statement. The Ryerson witnesses were honest. The officers at 51 Division were honest. And reporters are honest. I can tell you who the reporters, CBC and Globe and Mail, independently confirmed what I'm saying, and then it gets quashed down at the last moment before publication. Where is all this information? The people gave this information to the review. It's omitted and censored out. Then you're all giving these accolades about transparency and accountability. No, there isn't any. It's a cover-up and it's a whitewash. Where's the next step? Convene the mediation room on Bay Street. Bring in all the witnesses. I've sent this out in email many times. No reply from no one. Police will keep saying, not our catchment area. Kobe Bryant was in there. Ukraine Jet 752 was in there. Coronavirus was in there. How is that not your catchment area? If it's not your catchment area, stop enforcing this mask bylaw. Where is all that information? Before I sent out the coronavirus warning email, I sent out Bataclan Theatre mass email warning. Every single division at Toronto Police has that in their submit box through the web portal. Every single division. No reply from no one. Incel Danforth MacArthur is in there. You're going to tell me again that's not your catchment area? It was in there. Judge Epstein has a copy of the email. The Ryerson witnesses were honest. They gave the same account as mine. They also reported the UFO abduction. There's witnesses all over town. Toronto Star, CBC, Globe and Mail, all of them had the forewarning information. It gets quashed before publication and it's censored. 911 call, there's a recording of that. Where's the transparency? Where's the accountability on that? Release the audio recording from the review. I'll sign off on it. Put it on YouTube. Where is it? It's a 1,100-page report, and you left out the most important thing? 0 point energy is important. It is working right now. Susan Gao at the Pentagon. I have sent her phone number to the Office of the Chief. They don't even bother to call her. Gao answers her call on the first ring. Or she will return the call if you leave the message. They know about the Ryerson UFO abduction. They are looking into it. All over the world, people have this information. It continues to get censored and blacklisted and ignored. Where's the resolution? Convene the witnesses in the mediation room on Bay Street. The board can do that. They have power and weight to throw around. Are you just going to ignore me for the next 40 years again? In 1990, I reported Paul Bernardo. The desk sergeant assaulted me and kicked me out of 40 College Street. And then
thank
again,
Mr. Wenzel, I have to wrap you up there. You're over your 5 minutes, but thank you very much for your deputation. Board members, any questions of Mr. Wenzel? Seeing none, again, thank you very much for taking the time to speak with us today on this item. Board members, can I have a motion to approve the minutes of March the 23rd? Vice Chair Nunziata, seconder. I think Ms. Kostakis was second. All in favor? Any opposed? Item number 1 carries. We'll now move forward to item number 2. which is mobile crisis intervention. We have a number of deputants on this item, but we will hear from the service first through their presentation. Then we will follow that up by deputations, and then we will take it into board for discussion. So starting with a presentation whenever you're ready, Chief.
Yes, thanks, Chair. I'll immediately turn it over to Deputy Yuen. Deputy Yuen will take us through that.
Thank you, Chief. Good morning to Chair Hart and members of the board. I want to thank you for this opportunity for myself on behalf of the Toronto Police Service and hospital partners to present to the board and to the public the expanded MCIT plan for Toronto Police Service and the hospitals. And I want to stress this is not a plan for the Toronto Police Service nor the hospitals. This is a inclusive plan that has been consulted with our partners in the hospital, our TPS members, our nurses, and the mental health community, members of the MHAP, and also the MCIT steering committee. So this is a collaborative effort. This is not a Toronto Police specific program. This is a program for the community. Allow me to take the next several minutes to present to you a brief explanation of overview of the board report that I submitted by way of PowerPoint. So, as you see, the MCIT expansion plan, it speaks to the November 20th coroner inquest of Nabico, which the jury recommended that the MCIT program for the Toronto Police Service should be expanded to reach out to more community members that are person in crisis. And also the plan covers 12 of the 81 recommendations. And I wanted importantly to stress this plan was consulted extensively and every step of the way, our MHAP, the board's mental health addiction advisory panel, has been consulted and provided valuable input. And this plan will speak to, it is a extension of the Toronto Police Service mental health addiction strategy that speaks to zero harm, zero death. Next. Our plan highlights a number of areas: de-escalation and diffusing crisis, clinical assessment of person in crisis. It is a plan, the MCIT is to prevent self-harm and harms to others. And one of the most important things is to divert person in crisis from criminal justice system and the hospital in emergency rooms, and provide avenue for immediate crisis intervention through community referrals for ongoing support. This is the plan. The board, through the 81 recommendations, wanted and asked the service and work with our partners to look for a 24/7 MCIT response. With the resources we receive from the hospital, we have to readjust and look at what is the best way of allocating our resources for calls for demands. As such, that our plan right now has increased to 12 MCIT teams. And you can see the current and the future state. And currently we have 7 teams deployed daily in our 6 catchment areas. With the new expansion, we'll be going to 12 teams and also a MCIT dedicated team for 14, 51, and 52 division for Monday and Thursday. Why are we doing this? Because historically, and looking back at data and analytics, those divisions received the highest number of person in crisis call during the past 5-6 years. So this is where we want to put additional resources to our downtown divisions. Currently, we have 10 hours of coverage. Going to the new model, we will have 14.5-hour coverage from 9 a.m. to 11:30 p.m. The board may ask why we're not going to 24 hours. Yes, we are looking at the resources given by our provincial fundings to our hospital partners. And also there are some contractual issues with our hospital, with the nurses right now, that they cannot work beyond 11:30 p.m. So these are conversations we're going to continue to have to expand the hours. So with the new expansion, we have increased our officers to 26 mobile crisis officers and also additional 8 nurses. I want to stress to the board, the officers are not net new. We have reallocated officers from other areas, and these are not new asks, a new budget request for the City of Toronto for officers. These officers within existing our complement, and we have reallocated officers for the expansion of the program. The projected expansion of the MCIT hours. Currently, last year we had over 7,000 calls where MCIT can get to. With the projection, with the expanded MCIT program, it is anticipated we'll be reaching out to over 11,000 calls per year. Certainly, that's not enough, because last year we received over 40,000 calls, but we are reaching out to more calls through our MCIT program. Next, please. I talked about this a little bit earlier about the demands for calls of service and putting our resources where the demands are highest. As you can see from this graph, and this is a daily 24-hour graph for person in crisis calls in the city. So if you look at some of the hours, at 7 a.m. in the morning, there are 3 calls on an average every day throughout the city for person in crisis. But you look at the hours where we have the overlap. Those are the times where we have the highest number of person in crisis calls throughout the city, and also those are the busiest time for the hospitals. And one of the goals of the MCIT is to divert clients from the ER rooms, and especially with COVID right now, the ER rooms are I think everyone can appreciate is overworked, and a lot of people are there. So it is a way of leveraging the resources we have and putting our resources where the highest volumes of calls are for those overlaps. Next, please. So we know we cannot get to mental health calls with the MCIT for 24/7. One of the things, this is a new program developed by the Toronto Police Service to speak to having someone dedicated to attend calls for service when persons are in crisis. So we have worked very hard with our community partners and our hospital partners and our officers internally to have, this is a new program being rolled out by the Toronto Police Service. It's called Divisional Crisis Support Officer. In a brief summary, I want to explain to you our person in crisis calls are usually responded by our frontline officer. So each platoon, we're now going to have up to 4 and more officers having additional training in mental health, person in crisis. So the call, I will talk about the training and a little bit later on subsequently. But so now we have 4 officers, and each PRU platoon will be mandated to have at least 1, up to as many as resources available to have these officers solely address mental health, person in crisis calls to complement MCIT. But during the hours the MCITs are not working, they will be the first responder. Yes, it's not the perfect formula. We would like to have a nurse present, but these are something that I will continue to have conversation with the MCIT steering committee and with our hospital partners to expand those hours for our nurses. So this is something that we have introduced and as part of our commitment for the mental health addiction strategy, that to achieve zero harm, zero death. Next, please. Since October 2019, one of the things that we heard often is where are the clients going? So we have had a referral program since 2019, October 2019. In the Northwest, when I speak about the Northwest quadrant of the city, what I'm talking about is 23 Division, 12 Division, 31 Division. We have a caseworker where MCIT officer will make the required and necessary referral once they arrive on scene and triage the calls and speak to the clients. And up to this date, we have made over 85 referrals. And out of the 85 referrals, there have been over 1,000 contacts with our clients. I'd like to say this with the expansion of the MCIT program, also there comes along with an expansion of the caseworker referral program. So a referral program will be introduced in 2021 for the Scarborough catchment area. That's 41, 42, 43. We are continuing to have conversation with the province, with our health partners and our community agency to bring a referral program to the City of Toronto. Downtown core, what I mean is City of Toronto's downtown core, 14 Division, 51 and 52, because we know that's the highest volume of calls in terms of person in crisis. So as you can see from this PowerPoint, the clients are provided service up to 90 days, and I can say to you, many of them are beyond that 90 days because of the acute needs of our clients. And these clients will be contacted through referral within 48 hours. Next, please. So we'll talk about training. In the past, MCIT officer received only 40 hours. And we have heard from our MHAP members, from our community agency, even from our nurses and from our hospital partners and our officers. 40 hours is not enough to address the complex needs of attending to person in crisis and with the different racialized communities in the state of Toronto. So we have increased our training to 80 hours, and 20 of those hours specifically highlighted on equity, inclusion, and human rights. This is our commitment to ensure that racialized and our officers understand anti-racism in the area of Black, Indigenous, and racialized community. And I talked about the Divisional Crisis Support Officer Program. Right now, they're getting an enhanced 2.5 days mental health training. It really is a very condensed version of the MCIT course curriculum. They are getting additional training. So for them, we know 2.5 hours, 2.5 days are not enough. We're going to increase that training, and by the end of this year, there'll be 280 frontline police officers span out across all platoons throughout this city of Toronto that have additional training in attending to person in crisis calls. So this training, both for MCIT officers and the Divisional Crisis Support Officer, is evolving. And I do understand that the Toronto Police College has just now struck a community advisory panel to inform us on future trainings for Toronto police officers in different areas. And I can assure the board and the public that members of the MHAP will be on that advisory panel, and MCIT Divisional Support Officer training will be part of the informing us how we move forward to include it. So I just want to highlight on some of the things on the equity, inclusion, and human rights training. We have foundation concepts on anti-oppression, anti-Black racism, mental health, cultural considerations in Black communities, historic current hardship faced by LGBTQ2S plus and other racialized communities, and intergenerational trauma experience in Indigenous community. These are not topics that are suggested by TPS members only. This is through consultations with community members, with agency, with our partners, and these are some of the trainings that we're providing as the additional 40 hours for MCIT officers. Next, please. Along with the expansion, we know we need to have a new role profile. Officer and the community and our agents and our partners need to understand what are the critical roles, what are the clear roles and definition and guidelines for our officers and for our nurses. So the new role profiles, so officer will be selected. You know, they have to have the ability to recognize intersectionality of poverty, racism, stigma, and mental health, ability to manage bias, and also have the skills and attitude for possess anti-racist and oppressive attitudes. So there will be a new MCIT selection form, application form, and the TPC, the Toronto Police Service procedures will be changing to reflect these, the new expansion. And then also the nurse recruitment process have been refined and been reviewed by our hospital partners. Next. So this is very self-explanatory. We heard from the board, we heard from the community, we heard from our clients, we heard from our officers and our nurses that we need to change. And this is one of the 81 recommendations to change uniform. And this change did not come in a vacuum. We consulted with our mental health community, our police officer, our nurses, our agencies, and there was a survey and people live experience. And these are the results that came back, and this is going to be the new MCIT uniform being rolled out July 1st, 2021. Our officers will be wearing these uniforms, our nurses. I want to stress to the board and to the public, these are not new money. Every year, the Toronto Police Service has a budget for uniform. The money, so instead of getting the current uniform, the money is not new. The money is existing in the uniform equipment budget. So the money has been reallocated to get to outfit our uniform for our nurses and our police officers. Next, please. Equally, we heard many years that our vehicles is very militaristic. It's a police vehicle. Let's be honest with each other. And our clients, especially our clients, the family members that are suffering from trauma in crisis, they do not want to see, the community do not want to see a police vehicle attending the scene. As a result, we consulted with agencies, community members, members of the MHAP, our nurses, our hospital partners, our police officers. This is the vehicle that we're going to now have our MCIT officer and our nurses responding to calls. Once again, these are not new vehicles. These are existing vehicles that we have reshaped and repainted and changed the logos on it. So we're not buying new vehicles to support this expansion. Next, please. This is a new MCIT procedure. Really, in the past, and I know the Justice Yakabuchi has called MCIT should be first responder, and we heard that, and we have not changed, and now we have changed. We have consulted with our officers, with our nurses, with our clients, and all our partners. So they're no longer going to be a secondary responder. They will be co-responders. What that means is they will go to any calls along with our PRU officer, and the nurses will be staying behind the scene until we deem the scene safe. So this is a huge shift from where MCIT officers will be waiting for PRU, for a sergeant to call them to attend. They are going immediately to triage the issues and to have the MCIT approach immediately at the call. And there will be now direct supervision. In the past, MCIT was a program that had no linkage to direct supervision. Now, MCIT will be managed directly by our primary response sergeants. The sergeants will determine the attendance of MCIT. They will no longer be co-responders. So this has been reflected in our new procedure, and that will be giving us more timely, accurate, and proper attendance to person in crisis call. Next, please. This is a dashboard that we are now developing. Along with the expansion, we know there's a critical need to be transparent, to report both to our internal stakeholders and, more importantly, to our external stakeholders, how we are capturing, how we're achieving our goal of zero harm, zero death. And MCIT, person in crisis call, plays a special role in this. So this is something that is in the works. We're certainly going to be having a external public-facing portal for public can see how many calls we attend to, what are some of the results, what are some referrals, and the time on the calls, and are they habitual, frequent calls that we go to. So this is something that, and I know, and I can advise the board that MHAP has been consulted extensively along the way, and everything we do, we are presenting different models for MHAP and also for our community agencies, for our clients to see what we should have on the public-facing portal for reporting publicly for person in crisis. And I am anticipating this public portal will be, this part of it is already in running, but a full portal will be rolled out by Q4 of this year. Next, please. So we're talking. So one of the board recommendations is talk about MCIT expanded steering committee. So these are some of the membership, and I want to highlight we're still in conversation with the city's confronting anti-Black racism unit, and they will have someone at the meeting in June. I also want to say to you, to the board and to the public, we intend to have regular meetings, and the terms of reference will be a high-level policy oversight of the MCIT, and looking for gaps, looking for opportunity to expand, looking for opportunity to improve. And one of the most critical things that is looking for a independent review of the value of MCIT moving forward, and also collaborating with the city. I know the city has a very ambitious and a rightful program to looking at police should not be attending mental person in crisis call. This is something the Toronto Police supports. This is in the 81 recommendations. And the MCIT steering committee will have conversation because we know the city will be having pilot projects next year in different parts of the city with non-police response. This is where we can have the conversation. We can have those intersections where the Toronto Police working with the city and talking about how is the best approach. Next, please. Lastly, I'm very excited that the board will have a public report very soon. I'm optimistic next month for this. But this is the first time this is first in Canada that we are going to place crisis worker in a 911 communication center. It's a proof of concept for 1-year pilot. We're now in the final stages of I would say the legality. I will use that word with a partner agency, community agencies that has specialized in mental and person in crisis mental health type of services, and they will be partnering with us and having a crisis worker working in our communication center 911 on 703 Don Mills 20 hours a day to triage and to work with our dispatchers to look at calls where police don't need to attend and to divert that to community agencies. And we're doing a 1-year proof of concept pilot project for 14 divisions, 51, 52. This is all funded through the 2021 Toronto Police operating budget with no added cost. We will be reporting publicly on the terms of reference when calls, what are the calls that will go to community agency, what are the calls that the police will retain, and how we will be reporting and how we'll be measuring the success and the gaps. And so these are things that I will be committing to the board. But I'm very excited. This project is in the final stages, and it will be rolled out very soon, and there will be a public reporting to let the board and the members of the public know how we're going to engage in this new endeavor. And I'm very excited because in the Toronto Police Service, we receive over 40,000 person in crisis call. Every one of these calls diverted to a community agency is a successful day, not only for the Toronto Police Service, more importantly for people in for the mental health community. Next, please. So, members of the board, I thank you for this opportunity for allowing me to say a few words. You have my commitment. This is the start of the MCIT expansion. All expansion will take place by June 1st, 2021. This is a conversation we'll continue to have because we expanded does not mean that our work is done. Our work has just started because we have to look at how we can identify gaps, future opportunities, so to truly get to what the board has asked the Toronto Police Service and to deliver a 24/7 MCIT response to the City of Toronto. At this time, I want to ask the board for a couple more minutes of I want to introduce my co-chair of the MCIT steering committee, Ms. Sarah Downey of Michael Garron Hospital, and I can say to the board they have worked very hard with the Toronto Police Service to bring what I just presented to you today. So if you would not mind, board, I would ask Sarah to say a couple words, no more than a minute. Sarah, please.
Thank you very much, Deputy Chief. It's great to see everybody. This is a very happy moment for the Mobile Crisis Intervention Team, and that's a substantial expansion of this really important program that's been evaluated on several occasions to show the efficacy of this paired model of a mental health nurse and a police officer responding to people in crisis and providing highly qualified and sensitive care to people at a very important time. So on behalf of hospitals, where some of these people in crisis do come, it's a much better experience when people in crisis show up in an emergency department that have been assessed and safely transported to an emergency department. And so it's highly valued by the partner hospitals engaged in this program. And so the expansion is terrific news. I'm really thrilled that we have a top-notch advisory committee now in place to help us navigate some of the complex issues about the place of policing, obviously, in mental health crises, about the need for actually a far more comprehensive mental health system and more options for people in crisis to get care and service. And we've had our first meeting already with the deputy, and I look forward to further modifications and changes to this program. But thanks for your time today, and always it's a pleasure to work with my counterpart, the Deputy Chief of Police, who I know is passionate and feels a lot of attachment to and has advanced this program under his leadership. So thank you very much.
Deputy Yuen, thank you very much for your presentation. And Ms. Downey, thank you very much for your leadership on this critical initiative, working with the Toronto Police Service. Thank you very, very much. Before we go to questions of the service, we'll now hear from deputants, and then we'll bring it back into the board for discussion and questions of the service. So Doopy, when you're ready, could you put on the first deputant, please?
Yes, the first deputant is John Sewell. John, can you, you should get a prompt from the system now. John, if you can hear me, you should hit *6. All right, Chair, I'm not getting a response from John right now.
Can you hear me?
Oh, there we are.
Hi.
Yes, we can.
It's John Sewell. I'm speaking on behalf of the Toronto Police Accountability Coalition. In June of 2020, Toronto City Council decided police should be detasked of responding to calls involving those in mental crisis, and that this task and the money needed for it should be turned over to community agencies such as the Gerstein Centre. We believe that this decision should be respected, and rather than the police service expanding as proposed, including very extensive training, as we've just heard, 80 hours per officer, these funds should be released to the city so that community agencies can use them to create units available to respond to these calls. As we know, there are very substantial problems for those in crisis when police deal with these calls. You can see that with on item 11 on your agenda, where a person in mental crisis was killed by the police. These fatal encounters will only stop when police are detasked with responding to these calls, and community agencies are empowered and funded to make such responses. This should start now, with the funds police wish to allocate to an expanded police service being turned over to the city to be made available to these agencies. Secondly, I heard the comments by the deputy about the units being co-responders. Well, we don't think that's good enough. We think that the MCIT units should be first responders. We think that's the only way, in fact, to make some real progress on this situation. The report by Judge Gloria Stein, Missed and Missing, released last week and highly praised by board members this morning, concludes that police require transformative change, a police culture needs to be addressed, that detasking is required with the investigation of those missing, largely turned over to civilian agencies, and that the board should take a much stronger approach to controlling police operational policies. The board and the service has endorsed and supported these conclusions. Now is the time for the board to show that it means what it says. It should agree with City Council directive and agree that instead of new funds being provided to police responses to those in mental crisis, those funds should be provided to social agencies which will make those responses. Thank you.
Thank you very much, Mr. Sewell. Just before I'm going to pass some of your comments over to the Chief, before any board members ask you any questions, in case he would like to comment on some of the things that you raised. But as always, I want to thank you for your perspective and your insight into various aspects of policing. And I agree with you completely, as I'm sure the board does, that we need to respect City Council decisions that were made in June 2020. One of which, and I know you've read the report, one of which is the city, and I'll read it. City Council requests the Toronto Police Service Board to implement a 24-hour, 7-day-a-week program across Toronto for its mobile crisis intervention team program, which is exactly what the deputy is talking about today in respect of that specific direction from City Council. You know, I'm sure the council did it for a couple of reasons. One being that the new program, whatever that happens to look like at the end of the day, that city staff are working on, won't be ready to fully implement until at least 2023. So we have a gap that we have to address today. But also, I think in recognition that no matter what happens down the road, that Toronto Police Service members will always encounter individuals in crisis, and that it's critical for the members of the Toronto Police Service to have that kind of training and that kind of capacity so that they can do their job as best they can. But that said, I just want to turn it over to Chief Raymer for any comments that he might have, or the deputy on some of the points that you raised, Mr. Sewell.
Yes, actually, thanks, Chair. Before I turn over to the deputy, I will say that as the deputy spoke about briefly, is that we are obligated by the fact that the nursing partners cannot work the complement of hours that we do in terms of 24-hour service, and in addition to that, again by their own contracts, they can't be absolute first responders going to a call. So but we have escalated it to the point in terms of our response that they will be co-responding to the police. So we have the benefit of their expertise during those calls. So those are my comments, and I'll just turn it over to Deputy Yuen if if he can elaborate more, if he's got anything to add.
Thank you, Chief. I certainly thank you for those comments, Chair Hart and Chief Raymer. I just want to touch on a little bit about co-responder. So let's not lost with the words co-responder, meaning first responder. In the Toronto Police Service, with the Toronto Police Service, priority 1 to 3 calls are attended by 2 officers. Keep in mind, yes, the MCIT is an officer and a nurse, but in reality, it's a singular officer because the nurse is a civilian. And we cannot put our nurses in harm's way. And we go into a call where a person is suffering from crisis. There may be other circumstances that will dictate the call will be a priority 1 to 3, has to be 2 police officers. So our MCIT officer now are going with another PRU officer. So I wanna stress to Mr. Sewell that you have the expertise and you have the MCIT right at that moment, instead of waiting in the past where Justice Yakabuchi said we should be first responder. So co-responder equal to first responder. Having said that, we have assured the hospital partners that once we arrive, all nurses that respond will stay behind until our officers. Let's not lose sight that our MCIT officer is still a police officer. He or she will have to render the scene safe for us to take the appropriate course of action. And if it's a mental health approach, a person in crisis approach, then that's when the nurses will be invited in to continue that call. So I just want to make sure we understand on our language and the way we're doing business and approaching it with the change of the new procedure. And it's very significant that, that we changed our wordings from secondary to co, where you can say is first responder.
Thank you, Chief, and thank you,
Mr. Chairman, do I get a chance to respond?
Absolutely, Mr. Sewell. Go right ahead.
Yeah. So one of the things we know is that in other cities, they are running programs that deal with mental health crisis calls entirely by civilian units. So it's not as though this is something that's impossible to do. It's relatively easy to do. The reason that we've got a big gap in the city program, as far as I can tell, is clearly funding. And if the $2.75 million were made available to community agencies, I think they could be up and running relatively quickly. They know how to deal with these calls. They can, and if there's violence involved, they know that they can phone the police officer in case they're needed. So I don't buy this argument that says that, in fact, the police are expanding their service because the community agencies can't get it together quickly enough. And I think that, in fact, the police should be saying, yes, we intend to do detasking. We're going to do it fast, and that means we're going to turn that money over to community agencies right now. We can get out of this whole thing about whether it's a co-responder or a first responder. We can actually just give it to the community agencies and let them deal with it. Thank you.
Thank you, Mr. Sewell. Board members, any questions of Mr. Sewell? Seeing none, as always, Mr. Sewell, thank you so much for taking the time to speak with us, and thank you for your written deputation, rather. We appreciate it. Thank you. Julie, can you put on the next step?
Yes, our next deputant is Doris Fulton. Doris, you should receive a prompt from the system now. Doris, if you can hit *6. There you go.
Yes. Hello. Thank you. Hi, this is Doris Fulton speaking, and I am a member of Trinity St. Paul United Church Center for Faith, Justice, and the Arts. And I have a number of concerns about the MCIT expansion. Firstly, I note that the City Council requested that Toronto Police Services Board direct the Chief of Police to support the implementation of 4 community crisis support service pilots, a referral to a community crisis support service to the 911 call centers as a dispatch option, train 911 call taker staff about the pilot and its objectives, do an analysis of the feasibility of moving 911 operations from Toronto Police Service to non-police city service, and developing other options for non-police interventions with vulnerable people, including scaling up existing health and social service providers. So we have this direction from the city, but I'm not seeing evidence of this when I take a look at the entire MCIT plan as presented today. And I am also going to be grateful for the thoroughness of the work that was done here. So I have these concerns because it looks to me as though what we're doing is we're bulking up more police officers when we're trying to find a way to reduce police involvement, not increase it from the perspective of the city's community pilot. This doesn't square, it doesn't look right, and it's very confusing. Now, secondly, what kind of collaboration is being engaged with the City of Toronto pilot, especially around the 911 call taker and non-police personnel beyond nurses, who could be, by the way, social workers, could be counselors, could be therapists. Why are we ignoring that level of support here? So I have 2 overarching, I guess, concerns that this is confusing. I'm concerned that we're not collaborating between the city and the police. And I think there's a great opportunity with the work that's currently being done to start to integrate that into the current thinking, current planning of the city staff that have been engaged to work on that. So those are my overarching concerns. The final one is also the roles and responsibilities of the steering committee. It sounds like there has been some thought given to that, but I'd also be interested to know a little bit more about what the planning is there. So those are my comments. Thank you for your attention.
Thank you very much, Ms. Fulton. Before I ask board members if they have any questions of you, I'd like either the Chief or Deputy Yuen, whoever would like to comment on some of the issues you raised, to comment on those now. Thank you.
Yes, Chair. Actually, I'm going to I'll make one comment that just to mention, to address the deputation, that the City Auditor General is looking and doing a review of our communication center in response to the City Council's request. But more importantly, I think I'll turn it over to Acting Staff Superintendent Johnson, who is dealing with the city in terms of the ongoing pilots that we're collaborating on.
Thank you, Chief. And Ms. Fulton, thank you for those thought-provoking questions. It is complicated, but I can tell you the 3 components that the deputy had spoke about this morning.
I think we lost sound, at least I did.
I did too.
Chief, we've lost Rob.
Okay, I'm back. I had to change the mics. I apologize for that. Thank you,
No
Ms. Fulton,
problem.
for those thought-provoking questions. I can tell you that it is complicated, but please be assured, and I'll explain as succinctly as I can, that these three responses are actually integrated. We have to acknowledge that the police will always have a place in attending calls for persons in crisis, and there are some of the criteria that's outlined in the board report for fuller explanation. So that's the MCIT piece, which we've had for over 20 years. We've augmented to incorporate some of the recommendations from from our services board that are outlined in the 81 recommendations. The second piece is the crisis, embedded crisis worker in the Comms Bureau. That was, again, a part of a recommendation of 81. And as a matter of fact, it started before the city got their team together to put together their comprehensive community crisis safety support program, which we, the Toronto Police Service, have been stakeholders at the table. We actually meet twice a week on this, and you will see when more details come out. I think there has been a presentation, certainly to City Council and here at this through the Services Board, that the response is very coordinated and integrated. And those other two pieces, the embedded crisis worker and the mobile crisis teams, are part of that response. So there's no duplication. There's actually more coverage, better coverage in different areas of the city to the same goal. Our other two pieces, the MCIT program and the embedded crisis worker, will fit into the, if I can use the term, the gold standard that the city has undertaken with our assistance. We have the same people at the table with all three of these approaches, so everybody knows what each other are doing. And key at that is our communications people. So we're working out a process map, sort of how, what happens when a call comes in, what's the appropriate way. So it's not going to be where the call will come in and our first pass will be to say, what can the police keep? It's actually going to be, what can we divert? That's the that's the focus of all this. So I know it is complicated, but I hope I can assure members of the board as well as members of the public who are listening that it is an integrated approach, and the city has primacy in their pilot. Thank you.
Thank you very much. I think that explanation was very helpful. Back to board members. Any questions of Ms. Fulton, the deputy? Seeing none, I want to thank you for taking the time to be with us this morning. Enjoy the rest of the day. Libby, can you put on the next deputant, please?
Yes, our next deputant is Derek Moran. Derek, you should receive a prompt now from the system.
Hi, can you guys hear me?
Yes, we can. Go ahead when you're ready.
Just going to start my timer here. So in this report, it mentions teaching points, history of slavery in Canada. Just the history of slavery? What about teaching the current state of slavery? I just want to point out what it says in Article 42 of the Lieber Code, that slavery exists according to municipal or local law only. And what it said, what the U.S. Supreme Court said in Dred Scott versus Sanford in 1856, that slavery is created only by municipal law. And I also just want to point out the definition for board in the Police Services Act, which means a municipal police board. So in this report, it also mentions teaching points for residential schools. So by the way, who is going to come up with what these teaching points are? And just a reminder of who ran these schools. That was those who were paid with money taken by force from others, telling these Native people what to believe. And of course, anyone who tells you what to believe, by default, automatically means you harm, as they don't want you to go verifying for yourselves whether what they told you is true or not. So for instance, Scott Duncan has mentioned before what happened with Natives in the past. He says that it was the policy with Natives that prompted it. The Law Society claims to own all individuals, but they declare Natives to be property. Legally, the word Aboriginal means Law Society property. They claim that right by getting them to declare themselves Aboriginal, which you will find means away from original. You are programmed. People like me programmed you. And it's the same for words like person, citizen, individual, natural person. Using them automatically creates joinder when you declare yourself to be these things. Instead, this is what natives should have been taught about government. And this is from Bill's Variety versus City of Galt, 1975, Superior Court of Justice, and Rooks versus Bernard, 1964. Lord Devlin states that the first category, there's certain categories of cases in which an award of exemplary damages can serve as a useful purpose in vindicating the strength of the law. The first category is oppressive, arbitrary, or unconstitutional action by the servants of the government. The servants of the government are also the servants of the people, and their use of their power must always be subordinate to their duty of service. This is from Gagne versus the Queen, 1992, federal court. Kind of says the same thing, just in a bit different way. The first category is oppressive or arbitrary or unconstitutional action by the servants of the government. I should not extend this category. I say this with particular reference to the facts of this case. To oppressive action by private corporations or individuals. In the case of the government, it is different. For the servants of the government are also the servants of the people, and the use of their power must always be subordinate to their duty of service. So this is what natives should have been taught, but they weren't, and they're not. And that's because nobody works for government because they wanted to help people. They work for government because they long to have authority over people, to control people, and to make a living off those same people. They have developed a false sense of authority over. For example, telling people what they can or can't talk about at a police board meeting, even if they took an oath which included to uphold my fundamental guaranteed freedom of expression. So in this report, it also mentions teaching points, reconciliation, moving forward to build trust with the indigenous communities. It mentions that twice. Well, if it's teaching them about trust you want, you can start with Mercer versus Attorney General for Ontario. Supreme Court of Canada said in 1881 that the sovereign chosen by society holds the land in trust for the people as a fide commissum. Supreme Court said in Canson Enterprises versus Boughton, 1991, that the beneficiary is under no duty to the trustee. And those two excerpts from Donovan Waters' Law Trust of Canada text I told you about last month, Chair Hart. Professor Waters mentions on all essential matters the trustee is directed, and the words I direct without any restricting context were held to be as imperative as any words could be. And that's my time.
Thank you, Derek. Board members, any questions of Derek? Seeing none. Again, thank you as always, Derek. Juby, can you put on the next deputant, please?
Yes, our next deputant is Jack Gemmell. Jack, you should receive a prompt from the system now.
Hello, can you hear me?
Yes, we can. Go ahead when you're ready.
Well, I'd like to start on a personal note by welcoming, it's Jack Gemmell. I'm here for the Law Union of Ontario to make a deputation. A personal note, though, I have to welcome Ann Morgan, who I met, was it 1984 when she was a newly minted Crown Attorney? And just indicate to the board that Ms. Morgan has had a sterling reputation in the criminal law community for all those years. And I think you've got a good one. Our deputation really follows on the deputation of Mr. Sewell and Ms. Fulton. We are concerned that the proposed program expansion plan, which really should be a short-term stopgap thing, will only serve to entrench the Toronto Police Services in the role as the primary responder to mental health crises at the expense of development of alternative community safety response models. The ultimate goal has to be to move to a community safety response model as soon as possible. You have to get the police out of the mental health business as much as possible. I recommend to the board the Reach Out Response Network's report on alternative crises models as an excellent review of what's being done across North America in this area. This transition will require a buy-in by this board and the Toronto Police Services, and it has to have a firm and unwavering commitment. We don't want MCIT to become the police alternative to an alternative community response model. Ultimately, MCIT will exist, but it should be complementary to the primary community safety response. We don't want to have it evolve into a substitute for it. I have a very specific question as well, having listened to the response by the TPS, is will MCIT officers be carrying the usual complement of police-issued firearms, tasers, and batons on these calls? One of the problems in this area is the unwarranted use of force in this area, and I think this is a question which has to be addressed. Also, we're very concerned about the protocol for the 911 Crisis Call Diversion Pilot. We feel it won't divert enough calls for a non-police response. Just listening to how calls which have priorities 1 to 3 will not result in the dispatch of an MCIT as the primary response shows the problem that is there. The criterion is set out in Appendix 9 of the proposal show that, in effect, the person who is co-located in the 911 center, in fact, will be the low person on the totem pole. That is, their decision as to what will be a non-police response, I think, will be subject to override by the 911 police staff and supervisors. The criterion are much too broad and are virtually all-encompassing. Any call where there's a perceived risk of violence will be diverted. And, of course, perceptions of risk of violence, anything can be that if the person seems to be disturbed. And we fear they'll automatically fall into that category. And ultimately, our concern is that if there's a half-hearted effort to divert 911 calls, it will likely spell the end of the pilot. We're also concerned about something unusual, which is referenced in the report. There's a lack of transparency about the relationship between the MCIT program and the Countering Violent Extremism, or CVE, component of the Focus Table program. The plan, as it's presently constitutes, says there will be referrals to the Focus Table program. One of the components of the Focus Table program is this CVE. CVE, counter-radicalization programs like CVE have come under heavy criticism in the UK and the US for indiscriminate targeting of communities, usually Muslim, rampant civil rights abuses, intrusive and unjustified surveillance, and extensive privacy breach. The result has been the counterproductive stigmatization of vulnerable individuals and alienation of targeted communities. The MCIT program should avoid any association with CVE. The risk we see is that contact with the MCV will result in a referral to the Focus Table and may lead to inclusion of the individual in a CVE database. This absolutely has to be avoided. So those are our submissions. Thank you very much, and I'd be pleased to deal with any questions.
Thank you very much, Mr. Gemmell. Before I go to board members for any questions, I'd like to turn it over to the chief for a designate to comment on some of the things that you spoke about. You certainly spoke about a lot of things in your 5 minutes. I guess one of the overriding comments that I heard is really the service's commitment to the end state, if you will. So I'd like the service to try to respond to as much of what you said as possible. Chief, either you, whoever you designate, please.
Yeah, no, I'll have Deputy Yuen respond.
Thank you, Chief. Thank you, Mr. Gemmell, for those insightful comments. And I read your deputation. A number of things that I think I captured. Number one, Chair Hart put it very succinctly and accurately. The city is working on a plan to address person in crisis from a non-police response, which we fully support. And Acting Staff Superintendent Johnson and my team at the MCIT expansion team, we work very closely with the city and collaboratively and to make sure this is seamless transition. And you know, at this stage, I cannot say to you whether MCIT will be a permanent or not. I'd like to see that we'll get to an end state where it is a large percentage of calls that the police don't need to go to. Then we will step out of this game and we will back off from this business. But until then, like the chair said, we have a gap until now till the realization of the fully committed city response team with non-police response. So at this stage, we will be there to fill the gap, if we use that term. Number two, you spoke about use of force. You asked use of force. Yes, an MCIT officer is a police officer. Under the PSA, Police Services Act, they must be equipped with all equipment such as firearm, our expanded baton, our CEW, and handcuffs, and all the use of force options. So yes, they are fully armed. Having said that, in the Toronto Police Service has approximately 1,100 use of force. And this is one of the things that I want to be talking about: intersectionality, anti-racism, Black racism, Indigenous, because our use of force now, we're mandated to capture race-based data. So one of the things that we're considering in discussion with MHAB and community members at that public-facing portal, are we going to include use of force when we are responding to a person in crisis? And I think that's the right thing to do, so the public can see actual occurrences where Toronto Police Service have to use force that meets the threshold that we have to submit a use of force report. So that's my answer for that question. 911, I am committed to work with the agency and our communication management team and a communication center, and also different agency and community partners to look at what is the best way to triage calls. And I'm committed to full disclosure. What calls will be going to community agencies so people can have input. Community agencies such as yourself can have input and make suggestions to better us moving forward. So those are the answers I have in responding to your concerns.
Thank you very much, Deputy. Board members, any questions of the Deputant? Seeing none. Mr. Gemmell, thank you very much for your insight. Oh, Mayor Tory, I believe you have a question of the Deputant. I believe you're on mute, Mayor Tory.
I had a comment I wanted to make and maybe get Mr. Gemmell's response. I have great respect for his advocacy over a long period of time, and including today and some of the comments he made, notwithstanding the response we just got about the how these officers are equipped, shall we say, when they show up and so on. You know, when Mr. Sewell said earlier, and I have huge respect for him too, and he's held the job that I now hold in a different context. But, you know, when he said, well, we could just have handed the money over to these agencies and they could have picked up and started on this right away. If that were possible, I can assure you, I, for one, as the mayor, would have said, let's do it. But in fact, I trust he understands, Mr. Gemmell, that when you're dealing here with tens of thousands of calls and all that goes with that in terms of the number of fully trained professionals that even these agencies would need, where they're not responding to these tens of thousands of calls, all kinds of logistical considerations about sort of how they get there, how they tie into the 911 system. They are the ones that told us that we're on a timetable to implement this over a longer period of time. And I was immensely frustrated by that because I would like to see this happen as soon as possible. But I trust he does understand that it isn't as simple as just saying, well, here's the check with the same 2.7 million or whatever the number is. I accept his point and Mr. Sewell's about the fact that we don't want things to get entrenched such that there is no change later, but it does take time. And I'm mindful, and I'll stop with the question mark at the end of all this, mindful of what we did with people in large scale institutions who suffered from mental illness. We closed all those down many years ago, and rightly so, but we didn't have the system in place to take account of the needs of those people for support, and we still don't. All these years later, 25 years later, and we just don't ever want to be in that position again where you take away one thing that isn't working properly and that isn't right and don't replace it with something that's better. So I just would ask him if he has understanding of the fact that these things cannot be done simply by sending a check over to some of these terrific agencies, but they have to staff up. They have to figure out the logistics of how they respond to these calls as the police do today. And in the meantime, even now, we're not really covering 24/7 the people who fall into distress, even with the enhanced resources. So I just ask him for his comment on that.
Well, my view is, of course, you need a transitional period, and this expansion program is obviously is a stopgap. But the problem with transitional periods is the very simple problem that temporary fixes have the unpleasant habit of becoming permanent programs, and the board and the police services have to be absolutely committed to carrying through with the transition. And it may not be perfect and it may not be always pleasant, but it has to be done. And that's our concern. It's not so much with the existing plan as it is, it's really the corollary to it is, will we get through to the alternative community safe response models? Will they be implemented? And as you institutionalize a program like MCIT, it becomes hard to unwind it. And I think the board has to really be in charge of this, because if not, things will tend to fall in the cracks and we'll end up with the continuing imperfect system we're living with now.
Well, I'll say, Mr. Chair, to Mr. Gemmell, challenge accepted, and that is our responsibility. And I agree with him on that. So thank you, Mr. Chair. Thanks, Mr. Gemmell.
Great, thank you.
Board members, any other questions of Mr. Gemmell? Mr. Gemmell, thank you very much for taking the time, and we'll be very mindful of your comments. They were very well said. Thank you very much.
Thank you, Jack, for your kind comments.
Juby, can you put on the next deputant, please?
The final deputant is Miguel. Miguel, you should receive a prompt in the system now. Miguel, if you could hit *6 now. No. There you go.
Hello, can you hear me?
Yes, we can. Go ahead when you're ready.
Hello, can you hear me?
Yes, Miguel, we can hear you. Go ahead when you're ready. You can hit *6 now.
Oh, *6.
Please, if you can mute the YouTube. Miguel. Miguel, you just hit *6 again. You muted yourself. Miguel, if you can hear me, you need to hit *6 now. And please mute your YouTube. Sure, I'm afraid I'm not getting a response from Miguel right now.
Okay, what I would suggest then, Doobie, is we'll take this now into the board for discussion. If Miguel comes back on while we're discussing, we can pause and listen to his deputation.
All right.
Okay. I'll now bring this item to the board for discussion. First of all, questions of the service. I saw Vice Chair Nunziata first, Councillor Ford, Ms. Kostakis. So Vice Chair, when you're ready.
Thank you. So during the presentation to the deputy, you mentioned that you're reallocating officers from your existing budget. So in the report, I just want to question, in the report on page 1 of the report where you have a breakdown of the cost, including the uniforms and that, you're just giving us, is that amount, that total amount is just amount that the cost would be even though you're using your existing budget?
That's correct, Councillor. I'm giving a roadmap. This is how much it costs for MCIT officer with the equipment. So, but these money are absorbed in the 2021 budget. So, if we're asking extra, that would have been the ask to the city.
Yeah, and that's why I wanted to clarify that, because people that are looking at this report may think this is an additional budget that you're requesting. So I just wanted to clarify that, that in fact, because some of the deputants, commented on that. With the discussions that you're having with the city, you're having ongoing discussions with the city. And as you know, the Ombudsman as well, Council, approved that the Ombudsman reviewed police procedures and programs. So what sort of discussions are you having with the city so we can let the public know that you are having ongoing discussions and where you are at this point with the discussions with the city, so the public is reassured that you are working with the city?
I know this. I know the discussion, Councillor, is with all the recommendations, including the mental health, is being led by Acting Staff Superintendent Johnson. Having said that, my MCIT expansion team and our folks are always in discussions, but I want to turn that over to Acting Staff Superintendent Johnson to inform the councillor to address what type of discussions and how in-depth they are with different agencies and different partners.
Thank you, Deputy Councillor. Just to inform, we are holding weekly meetings, actually, at least a couple of days a week meetings with the folks that are involved in the crisis support program. But outside that, you will recall that we have the Auditor General from the city that's engaged with us right now. And we have just settled on a terms of reference after spending a month or 2 months providing unlimited access to documents and other materials, supporting supporting reports to be able to allow the Auditor General to come in and take a comprehensive look at not only our communications bureau, but also alternate service delivery programs that we have throughout the service. So that there are a number of things that they're going to look at. And that we're hopeful that there'll be some recommendations that we can action. Outside that, there are also some things that we're doing internally which align with the 81, looking at some programs that or other resources that we may be able to move or stop doing, and that's a continual review that we are doing. As far as the Ombudsman's insertion. I've read the recommendation from council. I personally have not had any meetings with the Ombudsman, and that hasn't been moved forward at my level yet within the organization. I'm not sure if it's at an approval stage, but we are working diligently with the AG and as well as internally looking at some of the things that we're doing. Are they more appropriately dealt with by third-party partners?
Chair,
you.
sorry to interrupt. Miguel just rejoined.
Thank you, Vice Chair. Mr. Morgan, I've added you to the list of questioners. With the board's indulgence, given the technical issue that Miguel had, I would suggest that we listen to him now and then come back to questions of the service if everyone's okay with that. Doobie, could you put on Miguel, please?
Yes, Miguel, can you hear us?
Yes, I can.
All right, go ahead when you're ready.
Okay, thank you, Mr. Hart, for allowing me to speak on this item 2 that is close to me because I have mental illness as well. Mr. Hart and board members, this program will have had much impact if right from the get-go we could have handed this issue to the experts, to civilians many years ago. Today's Thursday, and I want to draw an item that I spoke to this board many years ago. It is in relation to the use of shields, police shields that one of those that is used by other agencies and movies. You see it on TV, And they are implemented by other police agencies with great success, especially when they're confronted with people with knives or other objects like baseball bats, with great success to disable that individual from hurting himself or hurting other people. Look, I had these conversations with former chairperson Andy Pringle many years ago, and he said to me, Miguel, I like the idea, but it appears that to put the shields inside the vehicles, there is no space to accommodate those police shields. And to me, it was a big surprise to hear that that was the only reason why we cannot provide our officers with shields to prevent them to hurt from people hurting them or people, carry on actions of violence towards the officers. Yesterday, we have a meeting with 51 Division, and one of the officers revealed how he was shocked to see a machete, a large weapon, in a backpack, and he was really concerned that this item were in a backpack. And remember, last April the 13th, there was a call for a man with a knife. And I believe during the altercation, police tried to disengage the individual and de-escalate the situation, but shots were fired, is my understanding. So I think shields can save lives for both the police service members and also for people with mental crisis. So again, this is an idea that I submitted to the board. It's on record, on file. And this deputation is also part of the record because I have emailed to your attention, Mr. Hart, and one from Mr. John Tory. So those ideas can be reviewed in 2021 because they are effective, in my opinion, and it will be successful to protect lives. And also, I want to support what has been said already by previous deputies, that a community pilot will be a best alternative to handle calls for people with mental illnesses because your style has not been successful. I'm sorry to say this, but perhaps it's time to, push the button, refresh what we're doing with new ideas and with people with lived experiences that can contribute to ensure that people's lives are safe. So that's all I had to say today, and thanks for the opportunity to speak on this important matter, and have a great day.
Miguel, thank you very much for your heartfelt comments. We appreciate it. Board members, any questions of Miguel? Seeing none, once again, Miguel, thank you very much for taking the time to speak with us today.
You're welcome.
Now we'll go back to questions of service members. After questions, board members will have a chance to speak on this item. So questions of service members, over to Councillor Ford.
Thank you, Mr. Chair, and I want to start off by thanking Deputy Yuen and Ms. Downey for a really thoughtful and again, dense report, I would say, with a lot of information and a good path forward. But there are a few questions I have. Deputy, in your presentation, you mentioned around the 24-hour MCIT model, and there won't be 24-hour coverage of the MCIT teams, but I believe it said 19 and a half hours, or I have to go back to that slide here. But have we costed out a 24-hour model? I know you mentioned that there were some issues with the hospitals and some contracts. But if they were able to accommodate it, would we be in a position to staff it?
Yeah, thank you for that question, Councillor Ford. So first of all, it's 14 and a half hours. It's based on the best, I would say, return on investment with the funding that is given to us by the Ministry of Health. And I want to go back and The funding streams for the MCIT is a partnership between the Toronto Police Service and the hospitals. And the Toronto Police Service is certainly funded by the City of Toronto, but the nurses are funded by Ministry of Health. So there are two streams of funding. Certainly, if we go to cost it out, it will be at least, you know, I don't want to alarm the public. Certainly, the money that we're given right now cannot be sustainable for a 24-hour model. Number one. Number two, there are contractual issues with nurses, with the unions, and this is something that they have a different collective agreement than the Toronto Police Service. The nurses, there's some hours that they cannot work, and predominantly between the middle of the night from 12 a.m. to 7 a.m. in the morning, they do not work. So these are things that we continue to have conversations on. And certainly right now the 14.5 hour is to have overlap, looking at the largest calls for volumes, where we put our assets, our resources, where best serve the city and to serve, most importantly, the mental health community.
Mm-hmm. And that makes very much sense. And I think you demonstrated that in here, how you've landed on those hours of operation, and given the current resources, makes total sense. So kind of diving into this, so we have our divisional crisis support officers picking up during those off hours, if you would say, throughout the night. Just an understanding, I know you mentioned in the report, but what training does a DCS officer have compared to an MCIT officer? What's the difference?
Well, first of all, the hours will be drastically different because right now with the pressure, with the COVID, with the training, and we have, actually we have to delay a couple of classes already because of the pressure of the COVID situation at the Toronto Police College. So an MCIT officer gets 80 hours, and then they get every year they get updated and refreshed every 6 months, 80 hours to initial. The divisional crisis support officer at the initial is 25 hours. But we're looking to expand that, but we want to get that program started, and then we're going to look at opportunities and also identify some of the shortcomings, some of the gaps. So initially it's 25 hours, but we want to move it to certainly at par with the MCIT officer, because we look at this as also a succession planning, because these officers will make future MCIT officers as they transition out of the roles, the current MCIT officers.
Right. Okay. And then so you've made some operational changes where you said previously the MCIT teams didn't report to anyone directly, but now it is to the shift sergeant who's on. And so what is the responsibility of that shift sergeant? Is it on who responds to these calls? And I know the goal here is to de-escalate, but is it also his call to escalate, or if they have to escalate a situation? Or I know deep in the report you mentioned different scenarios of, if ETF were to show up or whatnot. So how does that work, and who makes the calls on the ground?
Well, let me clarify that. In the past, I would not say that MCIT officer had no supervision, but it was not a direct. Nobody knew who was responsible for MCIT officer, so it was a different divisional unit commander's decision. But now the procedure is very clear. The primary response shift that is on duty will be having carriage of the direct supervision of MCIT officer. The supervisor can direct the MCIT officer to attend and to take certain action. So and then also they will be also responsible for their supervision, for their conduct, for the behavior, for the job performance, and doing the assessment. So it informs. So there's a more of a streamlined approach. But having said that, the major focus with the MCIT procedure change is in response to the Justice Yakabuchi's recommendation many years ago that MCIT officers shall not be secondary responder, because it delays the time, and they had to wait for a sergeant or a other officer to say, "Can you please attend?" Now they have the direction, not the discretion. They have the direction. Now they are responding when as a person in crisis call comes in, they will be going alongside with a primary response officer. But having said that, the sergeant is there to ensure compliance and supervision. So that's where that has been built in moving forward.
Got it. So with that, Mr. Chair, if I may continue down this path of questioning. So if the sergeant is, I guess, calling, kind of supervising the MCIT team, will a sergeant have more training in how to, kind of evaluate these situations and what the MCIT team is doing?
Yes, in the report and in our presentation to you, there is a new selection criteria. There's a new evaluation criteria. Maybe this is a perfect juncture to talk about the performance, the bias avoidance, the bias detection. And the sergeant has a lot of tools. And during our supervisor course, then now we're going to insert a component on sergeant's evaluation. Number two, how do you check? There are often a question. We give them bias training and equity training. How do we detect it? There's a number of ways: by physical observation of the sergeants at the scene, clients' feedback, partnerships feedback. Our nurses often give us feedback about the performance of our officer, but we also have technologies now: the in-car camera, the body-worn camera. So these are all the features the sergeants are going to be trained, and it's going to be asked to evaluate an MCIT officer. And Councillor Ford, it's an evolving thing, because I have now put into the Community Safety Command, because evaluation cannot be a cookie cutter approach. We're now developing the evaluation for neighborhood community officer, which you care so much about. Every person cares. So now we're going to look at how do we evaluate neighborhood community officer, different than a primary response officer versus an MCIT officer. So this is something that is in my work plan to continue to evolve, to make sure that we have the best evaluation, not only for the officer, but because we are putting these officers out into the community. So we want to pick the best officer and have the best informed decision how these officers are deployed.
Absolutely. Excellent. And last question, Mr. Chair. You mentioned this briefly, Deputy, but what the city's been working on, the Community Crisis Support Services pilot, that's scheduled to start up Q1 2022. How does this line up with this, and what do you expect kind of that future rollout to look like? Because particularly 23 Division, which is the area I represent in North Etobicoke, is a part of that pilot. So how do you see that coming together? And that's my last question.
I see a lot of potential. I see a lot of information being exchanged to inform us how to move forward. Because if you heard, we all heard from deputations that if that pilot is successful, if those responses are successful, that's where we scale back and take a step back and say this is where it's more of a predominant community-led response. And we already started those conversations with the city where the pilot with the non-police response are. And I see it will be a very involved discussions moving forward. We have already meetings with the city's team and then talking about collaboration because Q1 of 2022, Councillor Ford, you will have two types of approaches at 23 Division, a non-police response and a police response. And you know what? We need to speak with each other. First of all, collaboration. Number two is look at the best practices moving forward. Right now, I cannot say to you what the conversation will look like because we haven't seen any evidence. But I am committed. We are already started a conversation. We know we cannot work in isolation and silos. We have to collaborate. So these conversations will be taking place, and it will be, like I said earlier, the MCIT steering committee will be also heavily involved in those discussions and shaping how the models or the two models will work in any given geographic area of the city.
Thanks, Chief.
Thank you, Councillor Ford. Questions of the service, Ms. Kostakis, then Mr. Morgan, and then I have a question. Ms. Kostakis, when you're ready.
Thank you. Good morning, everyone. Just to piggyback off, I do have a question that I initially put my hand up for, and I'll ask that secondly. Just to comment on and piggyback on what Councillor Nunziati and Councillor Ford also mentioned to you, Deputy Chief, is the gap that we talked about with the nurses, etc., and to Mr. Langefeld's deputation and point about working with other community agencies as well with the best practices that are probably in place and filling specifically that gap when you talk about the nurses and the different unions and the 24 hours of service, that I know there's a lot of agencies that are out there as well that do respond to crises outside of even within the city. So the crisis response unit from the city that works collaboratively with all of us as well within the nonprofit sector. So I'm putting on my community and social service sector hat on right now. I believe that those filling that gap within those 24 hours, there are people that are out there that are already funded to work within the various agencies too that may be offline, could be discussed in keeping all those communications. So I appreciate the fact that you mentioned that there are various partners that are out there, but I think it's really important for our communities and for the public during these meetings to hear that the partnerships aren't just within the city and Toronto Police. It also includes, and you highlighted that very well, the other agencies and the community advocate groups that are out there right now in consultation with this project, so that perhaps one day eventually we seamlessly transfer over to the community-led and the social services and the people with the expertise that already exists out there to assist the police, because this is a combined effort and all stakeholders are involved in our safety and in addressing the mental health issues that are out there and people with who are in crises out there collectively as well. So thank you for acknowledging that too in the way that you've explained and presented. My second, or I guess my second, or my first question, that wasn't really a question, was on page 32 and some of the documents that we received. So for the board's purposes, page 32 in our note, but I believe page 13 from what you submitted. Under the governance, procedures, and MCIT supervision, which is the 5th paragraph, when there's a comment, and I believe it's procedure 06-04, and it's called emotionally disturbed persons. Is there a way, so I'd like some clarity on that. Is that listed right now and named emotionally disturbed persons? Or was that just in reference to something that was previously named that procedure? And instead of persons in crises, which has been most commonly used, and if not, can that be changed to persons in crisis rather than emotionally disturbed persons?
Thank you for that very timely question, and I will give you a very timely response. It has been brought to my attention by the community, by members of the service and the nurses and MHAP. Not only the Toronto Police Service has emotionally disturbed persons in our vocabulary, and also some of the board policies. So last week we convened a meeting with the Toronto Police Services Board with Sandy Murray, and we are committed to change that into not necessarily person in crisis, but we are going to consult with the community and MHAP and see what is the best terms to describe this. And then we'll inform the board and we'll make that change immediately, because yes, it is something that we're committed to do. And thank you for bringing that. And I also want to report back to you that we're very aware of it and we're making those changes as we speak. And so stay tuned. We'll get back to you as soon as we can after we consult with MHAP and the community what would be the best terminology moving forward. And it is not appropriate to use emotionally disturbed persons.
Thank you very much, and I look forward. I'll see you on the call at the MHAP meeting on Monday. Thank you very much for all the hard work.
Thank you very much, Ms. Kostakis. Over to you, Mr. Morgan. Just a reminder to board members, we're on questions only, and we'll speak to this item after questions. Mr. Morgan.
Thank you, Chair Hart, and thank you, Deputy Yuen, for your presentation. Just a quick question and just a bit of clarification for me around the selection of officers for that unit. Is it? I know the level of training was mentioned, but I guess a better understanding of how those particular officers are chosen in terms of the pairings also with the health professional. So is it a voluntary sort of piece? Is it an interview process? So just maybe can help me understand a little bit about the selection process and the sort of pairing process.
Thank you, Mr. Morgan. Like everything else, I have commenced a comprehensive review of our selection process, not only for MCIT officers, but neighborhood community officers and a whole host of other things. But I'll speak to MCIT. Yes, it is a application. And in our board report, we talked about a new job profile. They have to have shown the competencies that have demonstrated, along with recommendations from communities. Because as often I say this to you, a lot of our MCIT officers, they have past histories, past behavior, such as letters from community, how they deal with a person in crisis in a compassionate manner. We look at the files, and there will be an interview process, not only with the Toronto Police Service. The hospital partner sits on the panel as well, and also like I mentioned earlier, there's now a revamped process in the evaluation. But one thing I do look for, and I'm asking these hard questions: what are my diversity, gender, in terms of these officers? Not only for MCIT, but every officer that works at Community Safety Command, I ask these questions, and I'm demanding that, and I'm asking because we have heard from the community. Our officer needs to be reflective. It does not matter you're MCIT officer, because I know MCIT officers often are in racialized communities, same as our neighborhood community officers. Those are the questions I'm asking, and I'm asking my management of the divisions to make sure. If we don't have it, show me the succession plan. So these are some of the processes that we go through in selecting officer. It's not someone that puts their hand up about who's next in line. Those things do not happen anymore.
Okay. Thank you very much.
Thank you, Mr. Morgan. Any board members have questions before I move to speakers? I just have a brief question. Any other questions? Mayor Tory, do you have a question?
Chair, I'm troubled by this, and we've gone through the same thing with the TTC and how the special constables, and I was just looking, I've been furiously looking through the Police Act and the regulations, and also in the proposal here with regard to this business of these officers being armed, or armed with the full suite of things, tasers and whatnot. I can't find, and maybe you could just draw me to the place in the Police Act where it says you have to carry these weapons. I was trying to find it. The lawyer in me had me not giving up, but I just couldn't find it in the regulations or in the Act. And then I wondered whether, whatever the section says, is there a discretion on the part of a chief of police, because there's references to a chief of police authorizing people to carry firearms. Is there the discretion in the same place to not have that as a requirement, so that we could consider, because I was looking again at these very nice pictures of these shirts and so on, but thinking actually in a way, if you wear one of those t-shirts, it's going to look even worse with all that stuff. And I think that does intimidate people sometimes. I believe that in the case of the TTC constables, that I think it just creates the wrong impression in many cases. So if Deputy Yuen or somebody could speak to that.
Mr. Teschner, who's best to speak to that?
I would turn it back respectfully through the chief to Deputy Yuen or someone else. I think Mayor Tory, it likely has to also do with adequacy standards in addition to what's in the legislation, but the service should be in a position to explain.
Yes, actually, Ryan, you're absolutely correct. It does have to deal with adequacy standards, but more specifically, what I'll do is I'll let Council Marianne Wright speak to that issue as well, more specifically.
Hi, it's not specifically named in the Police Services Act, but the difference between just to roll back to the basics, the difference between a police officer and a civilian, of course, is the authorities the police officer carries and the reason you might have them there at the event that they've been called to. This, of course, is a secondary response. But the real answer lies in occupational health and safety and collective bargaining. So when you rejig the profiles and you begin to think about the circumstances they're involved in, and of course why they're there, then you start to think about what they need to do the job, and then you have to iron that out. So it is a little bit of a long and sticky process. The other thing I would say about it is one of the things you'll have to factor into your thinking is in the long term, hopefully we will reduce the number of times that police officers, whether it be in a secondary or a primary response role, have to go to those settings where people are not well and are probably in need of a different form of care. But as you said earlier, Mayor Tory, in your response, it's going to take a little bit of time to shift that responsibility back to the caregivers in the mental health community and off the shoulders of the officers. So does that help, or?
It does, and maybe, Mr. Chair, if I could just have one more question of council or whoever, the chief or anybody. Is it the case that there is a requirement either in the collective agreement, in the case of the Toronto Police Service, or in the statute or regulatory law, to have every police officer, including, let's say, ones that are involved in MCIT? Is there a requirement in either place? The law, the regulations, collective agreement?
I cannot be clear 100% on whether the collective agreement names it, but habitually they are, and there are occupational health and safety concerns, and there's a rationale in every role. So the answer is no, not always required by law or by statute, but law also includes those other factors. That's what I was trying to get at. So I can't give you a black and white answer. I'm not clear on the collective agreement, would have to come back to you, but I do think it would create a question that would have to be negotiated through labor because habitually they have been armed. Does that make sense?
I think it does, yes. Thanks very much.
Thanks.
Thank you, Mayor Tory. I just have a very brief question of the chief, actually. In the deputations today, Chief, we heard from 3 deputants in particular, Mr. Sewell, Mr. Fulton, and Mr. Gemmell, all said things related to kind of the end state and our commitment to the end state. There were comments from all 3 deputants. Can you just reiterate your comment, your stance as the chief of police of this city to the end state and the goal and where we're trying to get to with regard to persons in crisis, Chief?
Yes, the ultimate goal is to ensure that every call possible that can be redirected to an alternative form of delivery and service is done. And so that we get people with the training and the expertise that are probably in a much better position to deal with people in crisis than we are. So that is the goal, and is to reduce our footprint in this area and ensure that we're only there, particularly when there's a significant risk of violence and the police have to be there.
Thanks, Chief. I thought it was important to hear that again. We'll now turn it to speakers. Any members wish to speak on this item? Seeing none. I'll just wrap it up, Chief and Deputy Yuen, by thanking both of you for a very comprehensive presentation. And more importantly, I think your commitment to what both the board is looking forward to and the City of Toronto as a whole is looking forward to. Thanks to both of you and to your teams for a job well done. Really appreciate it. I'll now take this into the board for receipt of this item. Would a board member like to move receipt? Vice Chair, seconded by Councillor Ford. All in favor? Any opposed? That item carries. Thank you very much, everyone. We'll now move forward to item number 4, which is Vehicle Towing and Storage Service Contract Awards 2021 to 2026. I have a question of service members. Do any other board members have questions on this item? Seeing none. I'm sure the questions may be directed to the CAO, but my questions are, when I look at the report, I notice the rates, the towing rates are very different, whether it's downtown towing, if you will, or suburban towing. I understand the reasons for that, but just for my own clarification, for board's clarification, and perhaps the public, can you talk a little bit about the process and how you landed these contracts in terms of procurement, what that process was like, any dispute mechanisms you might have along the way for those individual companies who are looking to be selected and perhaps were not, and how the selection process ultimately ended in the best value for money for the Toronto Police Service. So if somebody could just comment on the overall process, I'd appreciate that. Thank you.
Absolutely, Chair, and our CEO, Tony Venetiano, will answer those questions for you.
Thank you, Chief. Thank you, Chair and board members. So any procurement that we do at the service, much the same as any other public sector organization, we're looking for a procurement process that's fair, transparent, and achieves the overall goals of best value or lowest cost to the service as well as the taxpayer. With respect to this RFQ here, our procurement people work very closely with traffic enforcement to basically outline requirements that we would expect based on a business model that involved 3 districts, an east, a west, and a downtown districts, all with their own sort of intricacies in terms of what was required in each district. And so that explains sometimes some of the differences in pricing that you might see. So we went through that process of developing the RFQ. The RFQ was actually issued in early January. It closed in February 18th. So it was on the street for about 6 weeks. And during that time, and this is to basically test and make sure that our document is actually fair and reasonable, proponents do have an ability to ask questions, and the service then has an obligation to answer those questions and basically then issue addendums where necessary. So we got about 27 questions. We issued 3 addendums. The call closed, and so we then went into an evaluation period. One of the things that we did in this one here is we had a couple of objectives. Number one, we wanted to ensure that we got as much competition as possible. So what we said in the call document is that, so for every vendor to see, is that a vendor could bid on all 3 districts, or they could just bid on one, but they would only get one, they would only be awarded 1 district. And the reason for that is so the multiple bids is to generate competition. The fact that we're only going to award 1 is really a risk mitigation thing, so that we're not putting all our eggs in one basket in the event that, let's say, a vendor can't deliver those services. And we've had situations in the past where we've actually come before the board where that has happened. So that's really operational continuity, and it just helps mitigate a risk. So when the evaluation was done, and it was done both by procurement and traffic, one of the vendors actually was the lowest in 2 districts, the east and the west. And so the mechanism then that we would use is we would look where it was the lowest in 2 different districts. We would award in 1 district, and then the other one would be awarded based on the lowest overall cost to the taxpayer, essentially, who's paying for those services. And that's what basically resulted in the recommendations that are before the board today. In terms that's basically in terms of dispute mechanisms, our bylaw actually requires and has provisions in it for a pre-award and a post-award mechanism, so that vendors can dispute before the award and after the award. I think it's like 10 days after the award. And there's also an opportunity during that time for debriefing. So one of the things that we want to do, and I think it's important to think is, where a vendor hasn't, let's say, been successful in getting the contract, that at least they have an opportunity to meet with us and maybe just go over where they could improve their bids in future, all with the intent of increasing competition with respect to the services that are being provided. The other thing is, when you do an RFQ, there's no subjective. It's really based on cost and submission requirements. The submission requirements in this regard, where your basic ones are operational in terms of the number of trucks that you need in a particular district, how big the pound has to be, what the configuration of the pound, but also what I would call some regulatory. Obviously, you need a business license to operate. And then there's statutory declarations that are intended to basically protect the integrity of the process. So as an example, a vendor would have to attest to the fact that they don't have, for example, an indirect or a direct interest in an auto repair shop, a salvage yard, or a collision reporting center. So they would have to attest to that as part of that process. So what you have before you today is really the result of a process that was very transparent. All the requirements I talked about were actually in the RFQ document itself. So everyone was well aware of what the rules of engagement were, how we would basically do the evaluation in the event that we got single bids or in the event that we had multiple bids, and how we then decided which ones would actually be recommended to the board for approval. And so the ones that are there today are basically following that process and are here for your consideration.
Thank you, Mr. Viziano. You answered all my questions. Appreciate it. Board members, any other questions of the CAO? Seeing none, can I have a motion to approve item number 4? Motion to approve. Motion to approve. Mayor Tory, seconded by Vice Chair Nunziata. All in favor? Any opposed? Item number 4 carries. We'll now move forward on the agenda to item number 6, which is the Toronto Police Service 2020 Annual Hate Crime Statistical Report. And Mayor Tory, you held that down for questions for the service.
Did, Mr. Chair. I've been spending quite a bit of time on this recently with the Asian community because there have been quite a few, an increasing number of episodes of anti-Asian hatred in the community. And of course, I was on a Q&A with the Muslim community last night. And I just wanted to ask in a general way, without getting into each of these individual groups that are all reflected in this report. First of all, and I just have a couple of questions, but first of all, is part of the reason that we can't bring more people to justice for the number of complaints we have here, which are going up, the cumbersome, I'll call it the cumbersome nature of the mechanism that's involving the Ministry of the Attorney General and so forth in order for a crime to be designated as a hate crime, or is that really not a significant factor in this? I sort of tend to believe myself that if more people were seen to be brought to justice for this kind of thing, that would act as a deterrent. But I don't know, and I don't know whether the service finds it frustrating to deal with these things because of those requirements that mean that these instances have to go off to the Ministry of the Attorney General for some special consideration.
Mayor, thank you very much for the question. Just by way of introduction, I'm joined today seated beside me is the unit commander of our intelligence services, acting superintendent Shannon Dawson, and our subject matter expert from our hate crime unit, Detective Karen Bisla, who will answer the questions. Thank you.
Good morning, Mr. Mayor. How are you?
Fine, thank you.
With respect to the question, there's a number of reasons why these cases may not be brought forward to the attention of the courts. In terms of hate crimes, which are criminal offenses that are motivated by hate, bias, or prejudice, those aren't specific criminal offenses. There's a section 718.2 that allows for the courts to take into consideration hate as an aggravating factor. The Ministry of the Attorney General's office does not need to be consented with respect to those specific charges. The majority of those, the charges that are reported in the hate crime report are hate crime offenses as opposed to hate propaganda offenses in which we do require the Attorney General's office. And with respect to why a majority of these cases are not being brought forward to court, approximately 50% of these occurrences are mischief to property-related offenses in which there is a lack of evidence, witness or victim statements, cameras, and other evidence that would be required. In other cases, there may be the individuals or the victim may want the person cautioned and it's resolved through that way. If it's an individual who is a youth, it may be dealt with by the courts through youth diversion programs. The cases that are brought forward the courts is where there is evidence of hate, bias, or prejudice, so that element would be required. Does that answer the question?
Yes.
Sir?
Well, it's very helpful. It is very helpful and very sensible too in terms of some of the mischief things you mentioned and so on. I'll just ask one more question because we could spend a lot of time and probably should on this, and I can do it maybe with you offline. When I talk to these communities, because I call them together fairly quickly, they would say to me that the first thing that has to happen is people like me and people in the police service and others have to sort of stand up and speak up when these kinds of things happen, and I try to do that. And they talk a lot about education, which I don't know is the responsibility of the police service. I think it's probably our collective responsibility somewhere other than in the police service, but with the cooperation of the police service. I just wanted to ask you, meaning you collectively, the police service members and those who are associated with the unit itself, if I was to ask you what the one or two things we could be doing better we in the collective sense to kind of cause these trends to turn back down again, what would they be? Because the community, they're quite properly asking me, most recently the Asian community, and it was in the wake of us having been told by, I think, Chief Raymer, that for the first time ever earlier this year, in 1 month, one particular month, the number of anti-Asian hatred incidents was at the top of the list. And not that you'd want to be at the top or the bottom of this list, you'd rather not be on this list and have no list. But it was just something that I then discussed with them, and they talked a lot about education. But are there any other things you think we're not doing adequately, we're not resourcing adequately as a city government or the other governments to try and push these trend numbers back down? Because they're deeply disturbing, and they involve a number of different groups, obviously, as your report tells us.
Yes, I can respond to that. 2020 was definitely an unprecedented year. Factors such as educational initiatives, global events, including the events that happened in the US, as well as the current COVID-19 pandemic, are believed to be contributing factors. As you know, these crimes are very different from other types of criminal offenses in the psychological impact, stress, isolation that they cause. We know that hate is insidious and it has no borders. The numbers that we saw in 2020 are very concerning and alarming, and unfortunately this trend is continuing into 2021. The month I think you're referring to is March. In March, we did see a spike in anti-Asian hate crimes following the incident that happened in Atlanta, the Atlanta spa shooting on March 16th. In an effort to address this, our unit remains committed to continuing education and awareness. Those are key factors in denouncing hate and ensuring that community members, victims of hate crimes, are able to recognize and understand hate crimes, and that we empower them to report so we can bring down those numbers. As you know, that there are certain reasons why people may not report. For example, language barriers. They may not believe that the crime is significant enough to report. Looking at community advocacy groups and what they're reporting, the incidents that are being reported, they are in line of what we are seeing, the trends that we are seeing here. So we know that underreporting remains an issue. And I believe that education is key and bringing awareness to these issues. And we will continue to do this in 2021, both internally and externally with our stakeholders.
Thank you. Thanks very much.
Thank you, Mayor Tory. Board members, any other questions? Chief, I just have one question of you, Chief. I know you expanded the unit since you've been the Chief of Police. My question of you is, do you have sufficient resources now in the complement to address this issue? Hopefully, this is very transitory and this 1 year is an anomaly and things will go down soon. But my concern is, do you have the resources to deal with what you're dealing with?
Yes, actually, I mean, we're continually evaluating that. I mean, this to use your point, really hope this is a very temporary peak that we're seeing, and it's unfortunately been caused and so much by this pandemic. But we are evaluating that. I think we have sufficient resources right now, but it is under consideration if necessary to do that. We do have the ability to scale up in the way we are structured within the organization to deal with this, and we're also coordinated provincially as well. So we do have the opportunity to address that and are very flexible in terms of how we move forward. But I think for the time being, we're okay. But certainly if that ask is made of me, we will evaluate and consider it. And we're constantly on top of it and monitoring it.
Thank you, Chief. It's just such an important issue. Thank you very much. Board members, would somebody like to move approval of this item?
Chief,
sorry, I skipped a step. Sorry. Board members, anyone wish to speak to this item?
I would just like to, for 1 minute, if I may, Chief, Chair. You were just in the process of saying, and you're right. I mean, I think this is so important. While it's a difficult report to, we could sit here and kind of piece it apart all day. I think the broader problems we should look at here are, first of all, and in a way, I would like to say to the Chief, we're going to count on expanding the unit because we're going to hope that people start reporting these crimes, because I think that important first step in actually coming to grips with it. And it's outlined in the report why people don't report these crimes, and it's quite logical as to why they don't, from a personal standpoint, that they don't want to sort of get involved and have to bare their souls, as it were, in cases. But I just want to say thank you to the chief for the fact that he's in a zero budget year in this unit this year, and I don't think it was responsive to numbers that were happening in 2020. I think it was just deemed to be a sort of sensible thing to do in a society here in Toronto where we, pride ourselves on the fact that that is not the way we live, and we don't have that sort of thought prevail. But I do take some responsibility for the fact that I think we are going to have to do more public education. In the course of one of these meetings I was having, I think with the Muslim community, they talked about something I hadn't heard of before, and you can't know everything in these jobs, which is bystander education as well, because there are people who, don't necessarily follow what they tell you in bullying in schools, which is see something, say something. And a lot of the problem becomes that there's one person who says this happened to me, and there's nobody who's around, even though they saw it, to give some backing to the person who's been victimized by this. And so I just think in our city, there's a lot of problems we have to deal with, some current and some longer standing. This one is right near the top of the list, because if we let this, slide and the numbers keep getting worse and worse and worse, even though the numbers look small in a city of 3 million people, this is the part that's reported. And so it really reflects something that is actually going on a much more widespread basis. All the anecdotes that you hear are ones that are not generally reported. And so I thank the police service and the unit for putting the report together, which I think will draw some attention to this. And I'm certainly mindful as I listen to these different groups, because I'm trying hard to sit down and listen to them, that we have some things to undertake with the police to educate, to help educate bystanders as to the help they might offer with this, to support the efforts of the police to bring people to justice who do these things. So I'll leave it at that. It's way too big a subject, as many of these are, to cover it all off in one brief discussion. Thank you, Chair.
Thank you, Mayor Tory. Mr. Morgan.
Yes, thanks, Chair Hart. I just two quick questions with the report. I recognize that the gender of these accused is part of the reporting, but I'm just wondering if there's a reason the race of the individual is not also included, so we can maybe get a better understanding of who and how some of these things are happening. So that's one. And two, as mentioned, we recognize there's a challenge in terms of outreach to community coming forward, whether it's a language barrier or fear or whatever the case may be, around these issues around hate crimes. So I was wondering what's being done to be sort of proactive in addressing those issues, because I'm sure many of this is probably underreported because of those factors. So I was just wondering, is there any proactive pieces being done to support community and also the race of these perpetrators?
Hi, good morning, sir.
Thank you.
Our unit is actively engaged in community outreach to bring awareness and education in the area of hate crimes. The unit participates in a number of education outreach initiatives. Some of those were included in the annual hate crime statistical report, but just to highlight some of the things that we did in 2020 included roundtable discussions with the provincial and federal government on looking at the legislation to see if it's whether or not it's effective enough. We've participated in police panels with community members to talk about some of the challenges of hate crimes when investigating hate and how we can better strengthen these cases to make sure that we bring them to court. Other outreach initiatives have included virtual seminars with members of the Chiefs Consultative Committee. We provided a number of these seminars, and in an effort to overcome some of the barriers, which would include language, we utilized one of our officers to provide a multilingual presentation to members of the community, just because that was a concern that was raised during that. So we will continue to make.
Yeah, it was a ridiculous inquiry I had, but I mean, these are the kinds of things that,
I'll just remind everybody to put their mics on mute.
Probably not to do it.
Yeah.
I just had a rant, like
Mayor
a total
Tory,
rant from Mike States on 6 o'clock this morning.
Tori, you might want to go on mute.
In addition to the outreach mentioned, we are actively engaged within our unit to better educate our officers here in Toronto, as well as the Ontario Police College. As I mentioned previously, I think education is key, so that officers, community members know what type of evidence to look at, what type of things that police take into consideration when we're attending these types of investigations. For example, hate is not always apparent. Officers could respond to an assault call, and unless the officer is asking specific questions with respect to, what happened, what occurred, where was the location, what was the event or the timing around the incident, those are significant factors that we look at, including, the perception of the suspect, the victim, utterances that were made. All that is collected and it's brought forward to the Crown's attention. So that is taken into consideration to make sure that these offenses are going to court and that we have successful prosecutions.
Thank you for that. I guess I'm more looking towards the collaboration with community organizations, community agencies, or given the impact on certain communities. Has there been any outreach or relationship being developed with community organizations and agencies?
100%. We regularly liaise with our advocacy groups, our community local partners. We listen to their concerns. I can say that next week on Monday, in fact, we have a virtual seminar that's scheduled with a number of partner agencies in 42 Division, where we'll be providing hate crime seminar and education training. Additionally, we liaise with universities and colleges, work with them in their academic research to address some of the barriers and issues surrounding hate crimes. Other agencies that we work with are roundtable discussions. We have participated in roundtable discussions with the mayor's office to listen to some of those community concerns and to hear firsthand their personal experiences, so to better educate us as well as to what we should be looking at, but also to address the concerns of the community.
Okay, thank you. Thank you for that.
Thank you very much. Vice Chair?
A comment. I'm not asking a question, but just to make a comment on the comments made by the mayor. I think it's important, and I know you're doing that the public education and the outreach that we do is in various languages as well. That's very important. I just wanted to make that comment. Thank you.
Thank you, Vice Chair. Any other speakers on this item? Seeing none, can I have a motion from a board member to receive this item? Motion to receive, Ms. Kostakis, seconded by Vice Chair Nunziata. All in favor? Any opposed? Item number 6 carries. Moving forward to item number 7, which is a response to the motion with regard to the Toronto Police Service Intercultural Development Program and the application of the Intercultural Development Inventory Assessment Tool. Mr. Morgan, you held this down for questions of the service when you're ready.
Yes, thank you, Chair Hart. I'm just a quick question regarding the tool. I'm wondering, is there a reason why it's not a mandatory for all senior officers and not just the new recruits? Is there a reason why it's not a mandatory tool that's being used?
Yes, actually, Savina, could you answer that, please?
Yes, absolutely. Good morning, sir. So, the IDI tool was something that was recommended by the PACER committee in 2015, and since then, the adoption of the tool and the scalability of that program has sort of start and stopped over the years, in part from the moratorium and just not having promotions, and then the TTF. And so now we're renewing sort of the launch of that program. It is a development tool for the senior officers, and it needs to be seen as such. It, for now, is not considered mandatory, but that doesn't mean it's not something that could become mandatory later. We need a full year to really work with the tool, review the feedback on the tool before we ascertain the voluntary or mandatory sort of nature of it. To date, the inspectors have taken it. We're also going to be putting it in place for the staff sergeant process this year, as well as the sergeant. And the other thing to note is, even though it wasn't mandatory, with some strong communication and an understanding that this was a very important initiative and what a member is getting out of it, as well as a priority for the service, we did in fact get 100% participation rate for the inspectors that did do it, even without making it mandatory. And so we want to see kind of what this year looks like in terms of the program and the outcomes, and then make a call early next year in terms of the mandatory component.
Sorry, just to clarify, you're saying there's 100% of all inspectors, or just that, or just 100% in who? I'm not understanding. You said 100% in all that did it, or 100% in all for all inspectors that voluntarily?
During the promotional process of the 2018 and 2020 promotional process, there were about 49 inspectors that were promoted at that time. And to those inspectors, this tool was given as a development tool, and 100% of those inspectors did opt into the program to do the assessment, as well as almost all of them, except for a select few, also did the follow-up session and the coaching that came with it.
Okay, thank you.
Thank you, Mr. Morgan. Any other questions, board members? Anyone wish to speak to this item? Seeing none, can I have a motion to approve item number 7? Vice Chair, seconded by Councillor Ford. All in favor? Any opposed? Item number 7 carries. We'll now move forward to item number 8, which is a series of budget variance reports, and I believe we have 2 deputants on this item. Doobie, whenever you're ready.
Yes, the first deputant will be Chris. Chris, you should receive a prompt now.
Yes, hello.
Hi, go ahead when you're ready.
Thank you. Yeah, I'm looking at the 2020 operational budget for the service here. Chief, page 6 of your report under the premium pay section. And I just note that the, including the COVID-19 implications here, the total variation here shows a $5.1 million unfavorable variation. That's in addition to a budgeted $44 million for uniform overtime, and total of $49 million for overtime overall for the service. And I guess my question is, isn't this then an issue where we should be reducing the number of officers and the amount of time officers are spending responding to, for example, COVID enforcement in parks, or the number of officers out there responding to protests? I noticed, I mentioned before, the video that was there for Rebel News for last week's protest, and that showed a good probably 30 or more officers in the area, including mounted units and other officers there. And I can certainly understand that officers don't want to be caught in a situation where there's not enough of them there to respond. But at the same time, we look back, for example, at the G20 in 2010, and at that point we had roughly 20,000 officers there to respond to an average of about 10 to 15,000 protesters. And we know that that ended up being more problem than it certainly should have been, and the response to what violence did occur was not what we would have expected and been hoping for. So I guess my concern here is, you know, we talk a lot about reducing the budgets, about defunding police, about cutting the number of officers that we have involved in responding to these issues, and yet we see, in fact, we've got substantial amounts, $54 million in overtime pay for officers responding, and obviously some of that is necessary and can't be avoided. But really, the society is telling you that we want fewer officers involved in responding, and this goes back to we had one of the service members that responded to the MCIT issue here and was saying, well, police will always be involved in responding to these kind of issues. And I recognize a lot of the other people there sort of rolled that back and said, no, we're looking to hand this off to third parties. But there is this sense that police are naturally inclined to respond. Obviously, you're there for a very good reason. We need police. We require your response, and when we need you, boy, oh boy, do we need you. But the rest of the time, obviously, we want to temper that response. We only want you responding when we do actually require the force of police, not to necessarily say always violence, but the authority, let's say, of police officers to be there to enforce the law. And at the same time, as we look at the MCIT units and passing this off to civilians, we want to be able to take as much as we can that doesn't require armed individuals that have the authority under the law to act and to enforce, but rather we want people that are there to negotiate. And so I think that comes down to where we need to be looking at, are there situations where police are responding that they don't need to be? Do we have officers out there putting in overtime when in fact we expect them to be rolling back the number of hours that they're out there, and we should be coming in well under budget? I think most of us would imagine now with COVID going on and the amount of time that people have been stuck in their homes and not out interacting, while certainly some issues like home violence and things like that have increased, we would expect the majority of crime has decreased, and so the need for a lot of police response should be decreasing, and I hope we'll see that. I also note that with the MCIT, we talk about how it takes time, and yet I note that this was something we started discussing last summer, and even now it's still being put off to now it's going to be beginning of May that the next
Thank you, Mr. Langenfeld. I have to wrap you up here now at 5:25, but thank you, Mr. Langenfeld.
Okay, thank you.
To the Chief, would you like to comment on any of Mr. Langenfeld's deputation?
Yes, Chair. I just simply say there's a number of issues here that need to be addressed, and first and foremost, it is this pandemic that's caused us some very different operational exigencies that we must address in terms of demonstrations, definitely on weekends and quite often through the week as well, that we're having to respond to. And our paramount concern, of course, is public safety. And of all of these issues, we have a large senior planning group that reviews operational plans, and we are very diligent in ensuring that we don't have too many resources, but at the same time, we actually have sufficient resources to address the issues that might arise. And sometimes just having sufficient resources is why issues do not arise. And that's really some of the aspects in terms of the cost of policing. We as management teams as well are reviewing daily in terms of our unit commanders, our senior management team, where we can rein in the costs of overtime where we can. And the CAO is constantly referencing that and providing updates of where we are in terms of our spend. But I have to tell you as well, the pandemic has also caused us issues with respect to members off with COVID, members in isolation that cause specific demands on our operational issues on a daily basis. So there's a whole number of issues that impact how we're spending money that way. And the pandemic has had a significant impact on that, and not necessarily a reduction in terms of our daily operating costs. So anyways, those are some of the issues at hand, but I want to assure the board that this is top of mind in terms of how we can rein in some of those costs. And when we have to put the resources out there, it's not done without any really significant concern on how we can minimize those costs and still do it safely.
Thank you, Chief. Board members, any questions of the deputy? Seeing none, thank you, Mr. Langenfeld.
I would just like to respond to the chief there, just in terms of him having said the quantity of policing required to be ready to respond to protests should they get out of hand, for example. And I'd simply like to suggest that not everybody would necessarily agree to what looks from the outside to be almost a one-to-one relationship of officers responding to numbers of protesters, that is actually necessary and appropriate. And so I think that's where there needs to be some public discussion about whether I understand the officers feel that that's necessary, but whether in fact the rest of us agree with that is to see my point. Thank you.
Thank you, Mr. Langenfeld. Doobie, can you put on the next deputy, please?
Yes, Chair. Next speaker is Derek Moran.
Hi, can you guys hear me?
Yes, we can. Go ahead when you're ready.
Okay, I'm just going to start my timer. I just want to say, by me speaking at this meeting, this shall not be deemed to be in any way my consent expressed or implied, and doing so is fraud. God bless Her Majesty the Queen, and long live Her Majesty the Queen. And let the record show, as individual mentioned in Premier Ford's stay-at-home order is defined as a natural person in the Legislation Act of Ontario. If I have ever led the Toronto Police Services and or this board to believe in any way that I am a natural person, then that would be a mistake, and that I ask all of you to please forgive me. And by the way, it is a disgrace, this new enforcement team plan coming into effect today, let alone the stay-at-home order, yet again, was not on the agenda to be able to speak on, but hey, there's always next month, huh? So in one of the reports in this item, it says, the board office has leveraged technology and facilitated virtual board meetings during the period of the pandemic in line with the advice from Toronto Public Health. Wow. Well, that's amazing. That must mean that the Toronto Police Services Board has been given access to all the peer-reviewed studies from Toronto Public Health, as Dr. Davila has consistently said that her health advice is based on the science, that being the evidence, the scientific literature, peer-reviewed studies. And I wanted to point out to the board the YouTube clip I have in my written presentation, where Dr. Davila explains to David Ryder of the Toronto Star that science is a very careful process, and it does rely very heavily on peer review and ensuring that appropriate methodology is being followed before you can actually land particular conclusions. Just to follow up on what Chris was saying to Chief Raymer, I hope Chief Raymer now, knowing this, is taking the time to read those peer-reviewed studies that obviously Toronto Public Health and Dr. Davila is providing to the board, to see whether or not they're actually making decisions based on peer review or arbitrarily making decisions based on conjecture. So in this report, it also says these virtual board meetings have also continued to ensure that members of the public can effectively engage. Of course, that wasn't my lived experience last month, with the board through the virtual deputation process, and that members of the public and media can listen live to board meetings through a YouTube live stream. So I do not consent to this item, as it is not in the public interest to give this board another single cent of public money that's taken by force from others, by the way. If you doubt that, Go find the taxing statute that says people have to pay property taxes. As long as this board, in the least, can't even be straight with the public on just what a deputation actually is. And just to review, so the newest member of the board knows from the get-go, this is from Lac La Ronge Indian Band versus Canada, 1999, where the Court of Queen's Bench for Saskatchewan said, within itself, the word depute contains the notion of superior and inferior. For example, I'm the superior, and you, Chair Hart, and the rest of the members of the board would be the inferior. The former possesses authority, but passes it on or shares it with the latter. In each instance, it is necessary to ascertain what authority was conveyed to the deputy. This is the definition for depute from Black's Law Dictionary, non-edition. A person appointed to act in an official capacity or as another's official's representative. This is the definition for deputation from the Canadian Oxford Dictionary. A group of people appointed to represent others, usually for a specific purpose, a delegation. Now, here's the definition that the board has for deputation. It means an address to the board or its committees at the request of a person or representative of a group or organization wishing to speak. You know, you probably have no idea what I'm talking about here, Chair Hart, but I can't tell you how much I resent how this board attempts to manufacture joinder with the public in its definition for deputation it uses with the use of the word person in it. Let's not forget what happened when I asked this board for the dictionary they used that got this from so I could verify this definition for myself. Diana got back to me and basically said that you guys invoked, you can't give it to me because you invoke solicitor-client privilege. But I provide below a court case from Alberta, which cites the Supreme Court, and my time's running out, but it gives 3 reasons why it's not a justifiable excuse not to give me what the name of the definition you're using that you got deputation from, that you used in the board's definition section. So that's my time.
Thank you, Derek. Any questions of Derek? Seeing none. As usual, Derek, thank you very much for your deputation. Board members, any questions on these reports, 81, 82, 83, 84, the 2020 budget variance reports? Any questions? Anyone wish to speak to any of these reports? Vice Chair Nunziata.
I just want to speak on the one report, just make a few comments. As the chief indicated when the deputant asked those questions, yes, in fact, since the pandemic, I know my office, and I'm sure Councillor Ford's office as well, we're getting hundreds of calls from the community on enforcement where there's large gatherings in parks and in parties. So there is a call for additional service. And as well, the gun violence hasn't ended. So I just wanted to make that comment that I agree with the chief. There are a number of calls that are coming in for more service from the police services. So, and I'll move the recommendation.
Thank you, Vice Chair. Anyone else wish to speak? Seeing none, Vice Chair has moved the reports. Could I have a seconder? Seconder, Ms. Kostakis, all in favor? Any opposed? Item number 8 carries. We'll now move forward to item number 9, which are reports regarding consulting expenditures. And I believe we have 2 deputants. So Doobie, when you're ready, please put on our first deputant.
Sure, our first deputant is Chris. Chris, you should receive a prompt now.
Yes, hello, thank you. I'm looking here at the board's, what is it here? The annual report, Toronto Police Services Board 2020 consulting expenditures. And I will note it makes it more difficult having some of these combined, and it certainly limits the public's opportunity to comment on some of these issues. For example, having 4 budget reports together probably isn't appropriate when there may be situations where the public needs to respond to different issues separately. But anyways, on regards to this consulting budget, I'm looking at page 3 here of that report, which has the breakdown of expenditures, and the top section of that for management and research. I note that looking back at the 2019 expenditures there's 2 items, and they're both to deal with development of transgender inclusive policies. And the first one, fine, it's $1,000, no big deal, makes sense. You'd want some external information and expertise. Then in August of 2019, suddenly we see $15,000 expenditure for this. And I start to wonder, okay, well, just exactly how much is there in the services, or I should say in the board's policies and documentation and whatever that actually requires this level of intensive review. Here we are, $16,000 worth of expenses in a year, 2 or 3 months of a full-time person's job working on this, and what are they doing, and where has the board ever spoken to this and approved these expenses? And then we look at 2020, in December of 2020, and we've got $51,000 expenditure, again, for transgender inclusive policies. This hasn't been before the board. It was never discussed. The board never approved these expenses. The public was never consulted on this. And here we are doing almost $70,000 in consulting expenditures, basically a full-time employee dealing with this issue that maybe you could understand the service having half of this much expense involved in dealing with this, because they have all kinds of policies and procedures and almost 10,000 employees. But no, we're talking about the board here and dealing with a dozen board members and employees and spending a full-time employee's salary on reviewing and developing policies and procedures without public consultation, which of course is in violation of the Police Services Act that requires that everything the board does basically be open to the public and be done in public, except where there's personal and private information disclosed. It's not on any of the documents. It wasn't approved by the board. It wasn't discussed with the public. And I'd like to know what you spent $70,000 on in this matter. Thank you.
Thank you, Mr. Langenfeld. Mr. Teschner, would you respond?
Yes, thank you, Mr. Langenfeld, for your comments. The amounts that you're referring to are all spent in relation to a settlement that was entered into between the Toronto Police Services Board, the Toronto Police Service, and the Ontario Human Rights Commission back in 2016. It arose from an interaction with a transgendered individual, and as part of the settlement, the board was required to review relevant policies and bring them up to speed with the Ontario Human Rights Code and best practice. But in addition, the service was required to review and revise, if not create new procedures, as well as training with respect to interactions with transgendered individuals. That was a significant piece of work. The amounts that you're referring to cover both the policy, it covers the public consultation, which you referred to, and it also covers the costs that the service is expending in having that expert review the procedures, create new ones, as well as the training associated with it. So it is a significant body of work, and it's also a legally required body of work in light of the settlement. The information about the settlement is available on the Ontario Human Rights Commission's website. The information is also posted on the Toronto Police Services website that tracks progress. And so all of this work is being undertaken in accordance with that settlement. It's also in terms of the actual budget dollars, amounts that are put in, considered by the board, and for the last couple of years approved by the board in the context of the board's operating budget.
Thank you, Mr. Teschner. Board members, any questions of Mr. Langenfeld? Seeing none, thank you, Mr. Langenfeld, as always.
If I could, I thank you for your response. I would just ask then in future that first of all, this item being, as you indicate, both service and board related, should probably be, if not on the services budget as opposed to the board's budget, should at least have a note. And there certainly should be reference to in this expenditure and expense report that that this is in regards to a settlement and some of those details, as opposed to simply saying that these expenses happen. But I thank you for the response, and thank you for the opportunity to respond to Mr. Teschner.
Thank you, Mr. Langfeld. Could we please put on the next deputant?
Yes, Chair. The next deputant is Albert Zangsel. Albert, should receive a prompt from the system now.
Yeah, hello. It's my same deputation I gave earlier. There's glaring omissions in the review's final report. So there's a copy of the email, a recording of the 911 call, and honest witnesses. And all of that is left out of the 1,100 pages. So I'm going to say again, I'm looking for a resolution to this, and I ask the board to throw their weight around and use their power, convene the witnesses in the mediation room on Bay Street, and do a new cross-examination. They gave the same account as mine. Ryerson University, multiple witnesses. They knew about Incel Danforth MacArthur as early as 2011. It is phoned into 911. It is sent to every single email address at Toronto Police Services. No reply. The 911 operator sent out a car and took an English student from Ryerson to 40 College, and she warned it of Incel Danforth MacArthur. Andrew Kinsman is still alive. Reese Fallon is still alive. And, Anna D'Amica is still alive. The review knows this. They have a copy of the email. They have a recording of the 911 call. Why is that omitted from the final report of 1,100 pages? I would like to hear Mark Sandler answer to that. And Judge Epstein. I believe it's Judge Epstein who made the final decision to censor all of this critical evidence. I can predict the next terrorist event with name, date, and place. Since 1990, I've been reporting this to Toronto Police. Every single time they squandered the information. They knew about Par Bernardo in 1990. The desk sergeant assaulted me. In 2006, they have the Bataclan. They know about Bataclan Theater. They know about Fukushima. They know about BP oil spill. Toronto Police will just say, not our catchment area. All of the information gets squandered. The information has been sent out all over the world. U.S. intelligence services have had it. CIA, NSA, FBI, the Pentagon. Susan Gao from the Pentagon acknowledges receipt of the information. They knew about coronavirus. They knew about Ukraine jet. They knew about Kobe Bryant. The review has an audio recording of this. Release it. Put it on YouTube. Why do you keep saying transparency and accountability? Where's the civilian oversight to this? I sent them a complaint email. No reply from anyone in that community advisory group. No reply. They had the coronavirus forewarning right under their nose. Why did Kobe Bryant's helicopter still crash? Why did Ukraine jet still crash? What did Mark Sandler do about this? No reply at all. No transparency. No accountability. Stop saying you have that, because you don't. I'll tell you what. Release the audio recording on YouTube. It's recorded on audio. Release it. Put it on YouTube. Show a copy of the email. Release the 911 recording. The reporter at the Globe and Mail has a recording of the 911 call. The 911 operator is honest. She sent a radio car. They took an English student from Ryerson to 40 College. All of that omitted from the final report. It goes on for 1,100 pages. They leave out the most important thing. Then you're all to pat yourself on the back and say, oh yeah, we have transparency and accountability. No, you don't. Not at all. The civilian oversight should have been there to prevent this from happening. They didn't prevent it. It's missing from the final report. They have nothing to say. Who is getting an answer out of Sandler or Epstein? No one. Release the audio recording, put it on YouTube. Also, the coronavirus forewarning email, it went to MP Bill Murnau. The U.S. Consulate on University Avenue has it. Susan Gao at the Pentagon has it. I sent her all of her contact information to Office of the Chief. No one bothers to call her. No one tries to ground Ukraine jet. I look up NTSB and FFA on Google. They have a 24-hour emergency reporting system open to civilians. Why did no one try to call that about Kobe Bryant? They would ground the plane. No one does nothing. Information is correct. No one does nothing. I will urge the board again, reconvene all of the witnesses in a mediation room on Bay Street, take statements from Ryerson, from the Toronto Star, the Globe and Mail, the CBC. The reporters are honest, had the forewarning information, gave it to the review. All of the information is squandered, nothing is prevented. I can predict the next terrorist event. Calling 911 does not work. Multiple times they have had the information. Never once are they able to go arrest the suspect. Never once. They have always squandered it. In 1990...
Mr. Wenzel, I have to interrupt you. Your time's up. Thank you very much for your deputation.
Okay.
Board members, any questions of Mr. Wenzel? Seeing none, thank you very much. We'll now take the item into the board. Board members, any questions on these part 9.1 and 9.2, the two parts to this overall item? Any questions, board members?
Mr. Chair, I don't have any questions, but we are at item 9, which is consulting fees. Am I not correct?
That's correct.
Okay, so let's stay on topic. I'll move the recommendation.
Thank you very much. No one wishes to speak to this item? Seeing none. Vice Chair has moved it. Could I have a seconder? Councillor Ford, all in favor? Any opposed? Item number 9 carries. Thank you very much. Item number 10, I believe we have one deputant, and I would like to speak before the deputant starts. As soon as he's on, please let me know.
The deputant is on, sir.
Mr. Wenzel, can you hear me?
Yes, I'm still here.
Do you have anything new to add to this particular item? You've deputed twice today and said the same thing twice, which I very much appreciate. But do you have anything new to add to this item?
No, it's the same. It's the same thing. I'm just looking for a resolution, which they just keep ignoring. No one replies back.
Then I just want to thank you very much for showing up today. We all very much appreciate it. We understand your issues, and we've taken notes in that regard, Mr. Wenzel. So thank you very much, and enjoy the rest of your day.
Okay, and I just add, I sent an email, the witness list. You're free to cross them.
That's great. Thank you. We have all your information. Thanks so much.
Okay.
Have a good day. Board members, any questions on item number 10? Seeing none, anyone wish to speak to item number 10? Seeing no speakers, can I have a motion to receive item number 10? Vice Chair, a seconder? Ms. Kostakis, all in favor? Any opposed? Item number 10 carries. Thank you very much. Item number 11, which is a response to the jury recommendations from the coroner's inquest. On item number 11, I believe we have one deputant, and I'll thank Nicole Corrado for her written submission. And we have one deputant on this item. Doobie, when Mr. Langfeld's ready, please put him on.
Chris, you should receive a prompt now.
Okay, thank you, Doobie. And I appreciate this is the last item and we all want to go to lunch, so I'll try and be fairly quick here. This coroner's inquest into the death of Mr. Navico deals with his death due to taser use. And I note the taser was used 3 times, and it certainly seems from the report here that the officers responded understandably, and I don't have any particular problem with their response. I appreciate they have a tough job to do. But I note they used the taser 3 times here, the first time, and then a slight delay, and then 2 more cycles in order to actually try and force Mr. Navico to comply. And I'd just like to suggest to the chief that maybe this is an opportunity to look at some changes in the training here for officers, that perhaps if in addition to their trying to physically overpower the individual, which I understand they get into that mindset of it's now time to use force, and so that's the mode we're in. But perhaps if between those applications, your officers were also trained to speak to the individual and point out that, you know, I've tased you once. We're not going anywhere until we get your hands behind your back and you're handcuffed. If necessary, I'm going to have to tase you multiple more times, and be advised there's a medical risk to anybody, especially those that are on drugs. So, you know, you'd be smart to comply here and put your hands behind your back and let us handcuff you. And I realize that obviously when you're dealing with people that are in mental crisis or that are on drugs, that's not always going to be effective. But that doesn't mean it will never be effective, and just that extra little delay and switching officers back from force mode to conversation mode may get at least one of all these people to actually comply, and we won't be dealing with an inquest or a use of enforced inquiry or anything of that nature. I also note we recently saw in U.S. news reports the other week about the female officer that shot the young man in the car, apparently believing that she was pulling out her taser and having yelled taser, taser, and that I suppose you can understand in the heat of the moment that confusion happens, but that leaves me wondering if you know, we're large purchasers here from Taser Corporation, from Axon. We've purchased many thousands of these units, and so maybe there's an option here to add an upgrade to the technology where there is perhaps a sound component, where when the officer activates this unit and starts it charging and is getting ready to use it, that there's a downloadable MP3 file to the taser where it can, whether it's you know, generating a sound that sounds like the futuristic space weapon being charged, or whether it's a voice recording of you're about to be tased or whatever, that, you know, we can preemptively avoid this kind of bizarre situation ever happening here. But certainly anything we can do to avoid problems happening, I think we all agree we'd like to try and follow whatever options we can come up with. So I hope the service will consider those changes to your methods and maybe some discussions with Axon. Thank you.
Thank you, Mr. Langenfeld. I'm sure that Chief listened to all of your comments and will take them under advisement. Board members, any questions of Mr. Langenfeld? Seeing none, thanks very much for spending time with us today, Chris. Appreciate it.
Thank you. You have a good day as well.
Item number 11, could I have a motion to approve? Vice Chair Nunziata, seconder, Councillor Ford, all in favor? Any opposed? Item number 11 carries. Can I have a motion to adjourn the public meeting? Ms. Kostaka, second by Vice Chair Nunziata, all in favor? This meeting stands adjourned. Our next meeting is Thursday, May the 20th, 21, time and location to be announced later. Thank you very much, everyone. Have a good day.